Hey, Elsie.
Hi.
And for those who weren't on before, Steve is going to be about 5 or 10 minutes late, so we will start when he gets here. And if someone could promote Mary Anderson and Natalie.
I think that only Paola can do that, right?
No, it looks Paola and Tanya. You also have host abilities.
Doing it now. Good evening, folks.
Hi, Natalie.
Okay, they're both in. Thank you for noticing that. Yay, Steve is with us now. Good.
We
All
can't
right.
hear you. Okay.
Can you hear me? You can hear me now, right?
Yes.
All right, so, oh, look at that, we have Natalie Espino. All right, so Tanya's here. Waldis Cruz. Catherine Diaz. Sally Fisher,
Yep.
yes?
Yes.
OC Kamina, yes?
Aye.
Uh,
Sorry, Steve. I'm here. I thought it's Catherine. I thought you were just naming the folks you see.
Oh, no, no, I'm trying to take attendance. Emily Marte. Jay Mazer, yes.
Yes.
Wendy Pena. All right, so 1, 2, 3, 4, 5, 6, 7, 8, 9. All right, well, 1, 2, 3, 4. All right, well, we do have a quorum. And on the Kaylin is here, Kaylin C. Do we have Kaylin? Do we have the rest of your group, Sam and Jason?
I think Jason is logging on shortly and Sam has a family commitment, unfortunately.
Okay, and I don't see. I see Jonelle Daly. So does that mean that Michael McRae is on the line?
Hi, Mr. Simon. This is Chelsea Cipriano, also from the Health Department. Dr. McRae may be running just a couple minutes late, but I can get started in his stead. I'm the Executive Director of Intergovernmental Affairs for the Health Department. And, oh, Michael, did I just hear you? If that's you, hey.
Sorry. What's happening?
No, you're
I
fine.
don't know why my name came up that way. That's so odd.
Okay.
You're absolutely fine.
All right. So, but Chelsea, tell me your title again. Director of Intergovernmental.
Yep, I'm the Executive Director of Intergovernmental Affairs for the City Health Department.
Oh, fantastic. Executive Director. Okay. All right. Very good. And has Pauline joined us as well? Yes, Pauline has joined us.
Hi, Steve. Hi, everyone. Happy New Year.
Chelsea, you should know that Pauline is very dependable. Comes to all of our meetings. She's an excellent representative of the agency.
Amazing. We love Pauline, and she's taught me most of what I know about everything.
Okay, well, I don't want to compete with you as to who loves her more. We're gonna and Mary has joined us. Any other non?
Emily Marty has just joined you guys too.
Oh, thank you. Very good. All right, we're back. We're up to 7 out of 9, and I think I see. Yes, Mary Anderson. All right, so we have a crowded agenda as usual, maybe a little more crowded than usual. We're going to begin with the discussion about the Overdose Prevention Center that recently opened up at 180th Street and Amsterdam Avenue, sponsored by, operated by On Point NYC, which is a group that has includes the former Washington Heights Corner project. Kaylin, maybe you should lead off the discussion. And but actually, before we begin, I just have to mention that this is our first meeting since the passing of Betty Lehman, a longtime member of this board and a devoted member of this committee, a woman that everybody I think on this board loved. You know, not everybody loves each other on this board, but I think the one thing everybody could agree on was that we respected and admired Betty Lehman and the work that she did, not only for our board, but for the community as a whole. I just want to state for the record that we are going to miss her. And the board has already made that clear at its last general board meeting. And we devoted our last executive committee meeting to just talking about Betty and the respect that all of our executive committee members had for her and would still have for her. So Betty, if you're listening, we miss you, and we're sorry we didn't have more time with you. So having said that, let me move on with the agenda with the discussion about the Overdose Prevention Center. Kaylin C. is the Senior Director of Programs. Is it, I don't know whether your title applies to the entire organization or just to the corner project, but you can explain that to us.
Sure. Firstly, I'm so sorry for your loss, everyone. That's a significant loss. Yeah. Just want to clarify a few things. Steve, thank you for the introduction and the setup. The Washington Heights Corner Project will still exist as an organization under the merger. It's a little bit complicated. On Point will be the umbrella organization, and Washington Heights Corner Project will be one of the entities underneath it. The New York Harm Reduction Educators will be the other entity underneath the umbrella of On Point. And the merger, the legal aspect of the merger should be final any second, but I think you've been listening to us say that for the last several years, so it'll be final when it's final. I am the Senior Director of Programs for both organizations, but I know many of you because I started at the Washington Heights Corner Project and have been working with that organization since 2016. Many of you have weathered the journey of the 2 years of homelessness that we went through with the Washington Heights Corner Project, and I remain very grateful for this board and this committee's support over those really challenging years. In March 2020, we did get a new space at 500 West 180th Street and Amsterdam Avenue. Some of you have visited the space, and I want to say very clearly that there is always an open invitation to anyone from Community Board 12 to come and see the space and the Overdose Prevention Center anytime. I'll put my email in the chat, and you're welcome to reach out anytime to come and see the site, standing invitation. We have a 30-year lease in our building there. And we have a very supportive landlord, which was something that we couldn't necessarily say in our previous space. We, in addition to the OPC, are expanding our hours to 24 hours. So we're having the same hiring challenges that everyone else is having. It's been really, really hard to hire staff. But we're hoping that the first phase of the expansion will be completed by end of January, February, and that would expand the hours to 7 in the morning to 11:30 at night, 7 days a week. The current hours are 9 in the morning until 8 p.m. Monday to Friday, 9 a.m. to 4 p.m. on the weekends. So that's quite a significant expansion of hours for phase one. We're hoping that by sort of like late spring 2022, that we will add the third shift and be 24 hours, which is great because it's one thing when you're able to serve people during the day and take care of some of the community issues that we see, and then it's not a good thing to then have to close your doors and put everybody back out onto the street. So expanding our hours will go a long way to addressing some of the issues that we continue to grapple with in Washington Heights. Part of the expansion is adding for the first time a mental health harm reduction unit. And that means adding licensed mental health providers to our team in Washington Heights and adding a physician's assistant and a registered nurse to our team in Washington Heights. So opening a small satellite clinic in our space and adding mental health services as well. And that really addresses something that we've talked about over the years, which is the disconnect between addiction services and mental health services. So trying really hard to broaden our service portfolio and take better care of people by adding these services as well. Again, within the expansion, as you've all heard, there was also the overdose prevention program that opened on November 30th. So just over a month ago, we opened. Since opening at both sites, the numbers I'm going to give you are for both sites. So these are not just for the Washington Heights location. As many of you know, we opened a second overdose prevention center at our program in Harlem as well. We have 487 drug users registered to both programs. We've seen just under 3,500 visits at both programs, and our team has intervened in 78 overdoses so far. And we've only had to call the ambulance once. So the staff intervened so quickly and so effectively that we did not need to call emergency services except for one time. And the instance where we did call 911 was for a participant who had an underlying seizure condition that we felt was beyond the scope of our skill to manage safely. And the seizures presented after the overdose. That's a huge cost savings to the emergency services and hospital system. I cannot overstate what a cost savings that is. If you think that really kind of all told in terms of ambulance, fire, police involvement, ER stay, possible admission, each overdose can sometimes be a bill of around $30,000 and times 78 overdoses so far. Some other really encouraging early outcomes from the first month of operation is a real shift in the way treatment providers are relating to us. And this is something that I didn't expect. So we have treatment providers who are coming on site, sitting in the OPC with people who are interested in going to treatment, waiting for them, and then taking them to treatment. And anyone who doesn't work in the field of addiction, especially this sort of echelon of addiction, this really sort of street entrenched, chronic and relapsing addiction, it's hard to convince you how special that is. But to have a treatment provider come into our syringe service program and to wait for 2.5 hours for somebody to take them to treatment and to sit with them and to assure them it's going to be okay and they're going to be treated well is really quite staggering a change in the way that we're operating. And we're really excited about this new way of working with Promesa and St. John's and some of the longer term treatment providers that we have historically worked with, but now are engaging with us in a really different way. The Washington Heights location has 6 safer consumption booths where people can inject, snort, or swallow their drugs. And then it also has 2 smoking vestibules where participants can smoke their drugs. The Washington Heights model is a peer-led or consumer-led model, and the East Harlem model is a more traditional medical model. And we're engaged in an evaluation with New York University to evaluate the 2 models. What we're looking at specifically is engagement into care, uptake by the target population, retention and service, stabilization, and community impact, specifically around instances of improperly discarded paraphernalia, drug use, petty crime, homelessness, etc. Beyond that, we have just been invited to participate in the arm of the Rhode Island evaluation study, and that's being hosted by NIDA. So that's a federal study, and that's a really exceptional opportunity that we're really grateful to participate in. How did we do this? We, as you all know, have been running an unsanctioned overdose prevention program for 6 years. Many of you have come and seen it. Many of you are in support. Some of you were never in support, but this is a conversation, this is a dialogue that we have been having together for the last 6 years around the unsanctioned program operating at Washington Heights Corner Project. What we've done is a formalization of that program. It's a little bit bigger than the unsanctioned program, but it's cleaner, it's more dignified, it's better staffed, better resourced, and it has personnel that are available to connect the folks that we're working with in the Overdose Prevention Center into other care, medical care, mental health care, etc. It was a very unique political moment, and not a lot of community engagement was done. However, we're making up for lost time and have an open door policy at the OPC now. And I'm more than ready to answer your questions about why that decision was made. But I think the early data and the early outcomes we're seeing from the OPC really demonstrates how needed this particular intervention is in these 2 neighborhoods and how many lives they've already saved. So I think I'll pause there for a moment and see if Dr. McRae or Chelsea has anything else to add and to see if any questions have come up for anyone.
Yeah, Dr. McRae, do you want to jump in with a little bit more context and talk about the recent Board of Health statement as well, which I think is really important, and I can drop links in the chat as you talk.
Oh yeah, sure. So I think one of the things first also, I mean, that we want to know is that we are intentionally calling them overdose prevention centers. And that these are, it's a kind of addition to the menu of services that are already being provided by On Point. Sorry, Washington Heights Corner Project. That's the first piece. I also wanted to kind of just note that recently the Board of Health just in December last month, the Board of Health we issued a statement on taking. I'm sorry. The Board of Health issued a statement on taking action to prevent overdose deaths. So we really urge the federal government and the state government to support OPCs and other harm reduction services. So this is, a group of qualified, kind of independent medical experts, and who also kind of agreed, that had, obviously that has been posted, it's publicly available, and we really got some great ideas, and what they were fully supportive. So we have really been focused on really making sure that we are saving lives and thinking about how we can use this as a way to think about it across the city.
And Dr. McCray, first of all, I should have introduced you as being the acting. Are you the acting executive deputy commissioner for mental hygiene? Should I be saying acting?
Yes.
Oh, okay. All right. Well, we can maybe talk to the new commissioner. So, Dr. McCray, the ultimate plan, I believe, is to expand beyond the two neighborhoods into other areas of the city, so that people will have options and don't necessarily have to just go to these two locations. Is there a goal as to how many different sites you would like to have?
No, there is no current goal of how many we would like to have. We noticed that there's need that is across the entire city, and we really want to make sure that we're being thoughtful about where those are going, being planful, and speaking with community along the way. So there are no plans to put it in any specific place at this time. Really, we're focused on thinking about kind of where all the different needs across the city. We do believe it's a citywide thing that we should be focusing on this way.
And in the short term, do you have a sense of how many additional sites you might be able to open in the next few months?
Oh, I think, no, I think we're still working with providers, speaking with folks, kind of seeing who's ready. I mean, for this process, we went with On Point because we knew they were ready at that time to kind of move this work forward. But there are others, we are talking to them, but we are on different stages. We're on the planning process, but nothing there's no specific locations that have been determined.
All right, because I thought I read early on that there was a group in Brooklyn and maybe another one in Lower Manhattan that was also trying to gear up to open up a site, to open up sites. And with respect to the Board of Health statement, there has, as far as I know, there has been no negative response from either the state or the federal government. Nobody has come to the city, I believe, unless I'm wrong, to tell you that what the city is doing is wrong and that you should stop allowing these sites to operate. Is that correct?
That is correct. Yes.
Okay. All right. I just want to put that.
And Chelsea may want to kind of add.
Yeah, thank you. No, that's correct. And I also, the Board of Health, which I'm trying to figure out how to put it into the chat. Is it best to put it in as a Q&A, Steve?
Oh, yeah, I don't know.
Okay, I may not be able to. That's okay. The Board of Health.
Put it in the Q&A.
Okay.
Go ahead.
Okay, no, I'll figure it out. But the Board of Health statement also really not just called on the federal and state government for formal authorization, but also urged the federal government and the state to lower barriers to medication for opioid use disorder and treatment. So methadone, buprenorphine, and really pushing those levels of government to reduce barriers to access for those medications, as one might have lower access to diabetes medication or hypertension medication. A lot of concerns that we know folks have is a lot of services like methadone clinics located in neighborhoods, and these are critical life-saving, obviously, medications for folks. But this statement is really urging the federal government and the state government to think creatively and lower barriers to access, to include take-home doses and other types of approaches that would really help alleviate some of those issues and just increase access overall. So I wanted to just call attention to folks. I'll share it. It looks like a very formal, statement, a lot of really important sentiment in there, and the life-saving work that Kaylin, Sam, and their teams are doing right now, and truly life-saving, but also just a little bit more nuance about what the board has been calling on the state and federal government to do. So I'll drop that in if I can figure out how.
And I will also say that I would definitely take Kaylin up on the offer to come visit. I think one of the things that comes across in that space is the humanity of people, and treating people with dignity and pride, and really connecting with folks. And that's really the way to get them kind of with that relationship going, so they are more receptive to kind of care in the end. I mean, the humanity, I think, is beyond reproach.
Well, that's certainly good to hear. And I will take her up on that offer. But before I call on a couple of my committee members, I have maybe 2 or 3 questions for Kaylin. So there was an article in Patch today, the news service, which I don't have it handy, but if I remember correctly, it said that there were 47 overdoses that were prevented at the 2 locations. And the figure you gave us just now was 78. So is the Patch article using out-of-date figures? Is 78 now the up-to-date figure?
I would go with my numbers. My numbers are accurate as of last night. So we'll be getting a fresh set of data this evening for today. But the numbers I've given you are as of January 5th. So it's the latest and greatest. Okay.
And so what are we actually saying, that 78 people would have died if you had not been on the site to give them medication to reverse the overdose?
I love this question. I love this question so much. Okay, so anyone who visited our unsanctioned program knows that we formalized our bathrooms, and we built more bathrooms, and we put stainless steel tables in them and intercoms, and people were using on the tables, not on the toilet, but there was a door. And it was the toilet itself that gave us the legal protection, the plausible deniability, because what you do when you go in the bathroom and close the door is your business. We knew, just like the rest of the city and the country, that people were using drugs in public bathrooms and dying all over the place. And we felt, McDonald's, Starbucks, Burger King, subway stations, etc. We felt we had a responsibility to make sure nobody died in our program, which is why we formalized it. Many of you have seen it. We were doing 3-minute checks. So people had, because the program was in such high demand, because fentanyl was such a problem in the drug supply, we had a time limit. We don't have a time limit in the overdose prevention center, but in the unsanctioned program we did, because we didn't want people waiting. If people were waiting, then they would go and use elsewhere and be at risk of overdose death. So people had generally 15 minutes, and we would check on them every 3 minutes. In the unsanctioned program, if somebody overdosed and we didn't find them for 3 minutes, that overdose would have been, we were calling 911 all the time. We were using lots of naloxone. Those were very serious overdoses, even at the 3-minute mark. What's happening now is we're intervening at the second 1 mark. We're there at the minute the substance hits the system. There is no delay. So if we allowed the overdoses that we're observing now at second 1, if we allowed them to progress, it would be they would progress in the same way as in the unsanctioned program. They would progress to very serious, life-threatening, possibly fatal overdoses. In this new setting, we're able to get people on oxygen right away, use a very, very small dose of naloxone if needed, and it's all about preventing the loss of consciousness. It's about preventing the brain from shutting down at all. I know that many of you don't work in the addiction field, and so just bear with me, but that in itself is huge. So that's the long-winded answer to your question, Steve. Yes, many of those overdoses would have resulted in fatalities or very serious other health complications, particularly around, brain death or brain cell death and other complications. We will not confidently say that they would all have resulted in fatalities. I don't think that's fair to say. What would have happened is something bad would have happened to all of those people, whether it's brain damage, whether it's, there's a million, I don't even want to think about it. But we only intervene, our definition of overdose is anytime so sorry guys, baby. Anytime a person can no longer self-regulate or their three base systems, cardiac, neurological, and respiratory, are shutting down. That's the definition of an overdose. You need those three systems to live and thrive as a human being. And those three systems, cardiac, neurological, and respiratory, are in danger in an overdose setting, regardless of whether it's a stimulant overdose from cocaine, crack, K2, meth, whether it's an opiate-involved overdose, whether it's a benzodiazepine overdose. So we've had to broaden the definition and the understanding of what an overdose is.
Because certainly in the past, before the OPC opened up, and maybe even before you had the unsanctioned program, we never, as far as I know, we never had that kind of level of people overdosing out in our streets. We within a month period, 78 people overdosing. I don't know that happened in general.
So you didn't know because we didn't tell you. So remember, Corner Project had the unsanctioned program. We were still taking care of these overdoses. There were overdoses still happening on the streets, but I don't want to lose sight of the numbers that I've given you are from both sites combined. However, the Washington Heights site is leading an overdose occurrence. I believe 49 of the overdoses were Washington Heights. And the rest were the East Harlem location.
All right, well, let me just, I want to turn it over to my committee members, but let me just say, to me, the most hopeful thing that you spoke about earlier was the people who have agreed to go into treatment. And the idea that you have treatment right there on the spot, or people prepared to accept clients and bring them to treatment facilities. Can you quantify how many people have accepted treatment, have entered treatment, and maybe over the course of your program, how many people have successfully completed treatment and been able to overcome the substance abuse problems?
The answer is yes and no. Launching the OPCs was such a short time frame. The system we're setting up now is ensuring that the data and the service work produced by the OPCs is separate from the rest of our organization so that we can give you those very concrete numbers. Right now, it's all going into our main database. And that's just a symptom of frankly not having the time during the launch period to get new software and set up a new thing. But that's all going to happen because we completely appreciate that that's where we are now. So the fanfare around, yay, you did it, you launched, like that period is ending. Now we're shifting to, so do they work? Let's see the numbers. And we will be able to produce those very soon.
Okay, but let me just say, my last statement now is, I would love to see the numbers, not just for the OPC, but for the program as a whole.
Yeah,
I think what we need to be able to explain to people is the value of the corner project being located in Washington Heights, and to take it one step further, to have and I think I've requested this in the past, a zip code breakdown that would show the extent to which the program is serving residents of Washington Heights and Inwood, and because there are people who believe that it isn't. And it would be to your advantage to be able to produce that kind of information. So would appreciate it if you would do so at your earliest convenience. Okay, Catherine, you have a question?
Yeah. Hi, everyone. Hey, Kaylin.
hi,
Good to see
Catherine.
you. And props for
Nice to see you too.
multitasking with your child.
Oh, thanks.
I know it's tough. So I want to honor, I know everybody has a lot of questions. One, I just wanted to highlight, there's a question in the Q&A on Narcan access in Inwood. So if you can just pop something there, that'd be great. So first off, I'm curious, anecdotally, it doesn't, if you're comfortable sharing, I think you're one of the few people who has worked in sanctioned sites before. And I'd be curious, I know it's obviously really early stages to think about, what implementing this in the United States, in New York City, in the Uptown, Heights and Harlem, any major like takeaways, differences, or adjustments that had to happen. So that's kind of like my first question and thought. And secondly, I think it would be great, just throwing this out there down the line when there's more data, of course, for y'all to come back, and including DOH, perhaps to the Public Safety Committee, because I know one of the major things that kept coming up, and I think one of the major drivers was obviously around public consumption, encampments that happened across the city. And to hear, how beautifully you put and the amazing work that y'all are doing, I think it's we've been talking about public safety and the expansion of public safety and redefining public safety for so long. And so to have this presentation, I think within the Public Safety Committee under that lens, I think is really critical. Particularly, I think right now it may be too early, but that corridor of 181st Street, we're having all of these new developments and big box stores coming in really soon, or more of them, I should add. So to talk about, public consumption very locally, and how that has shifted in the Public Safety Committee, and even here, I think would be great to hear about that too, if there's any data. So I'll leave it at that.
All right, thank you. But what, 1 second, okay, Kaylin, what is your previous experience with working at one of these sites? It would have to have been in Canada, right?
It was, and I'm very careful to say that I'm not the former executive director that used to be at Corner Project. That's a different person who was also from Canada. I'm a very different human being, but I am also from Canada. And so these two sites, the Washington Heights site and the East Harlem site, are the 5th and 6th consumption program that I've been involved with. So it's a strange niche that I have a lot of experience in. And believe me, my mother wishes I chose a different career path, but here we are. And to answer your question, Catherine, smoking is the thing. Integrating smoking, right? Like we can see in the media, people are always referring to our injection sites, but they're not injection sites anymore. Fentanyl has contaminated the entire drug supply, and we're losing so many of our youth who aren't injecting, they're smoking. And that's kind of the new frontier of safer consumption, is really integrating smoking services. And I'll admit that this is where my big learning is coming in. How do we do that safely? What does that look like? What about when people are polymodality consumers? They inject and smoke. And it's been a real professional challenge for me to think through those new sort of like twists and turns in the safer consumption story. Looking to other parts of the world has always been have been very useful, but we all know that the American animal is very unique. And sometimes those innovations from abroad really just don't quite fit here. So we had to find something that really fit Washington Heights and really fit the drug users that we're working with in Washington Heights. And similarly, the program in East Harlem really fits them. And I think that it's important to remember that it's not one size fits all for safer consumption. It's an infinitely scalable intervention. And our two sites definitely look that way. Like the Harlem site has a smoking room that can, it's under construction, I should say, it will have, that will accommodate 4 to 6 smokers at once because there's such a large smoking population in Harlem. However, as we all know, Washington Heights, we have many injectors. So making sure that the program was able to meet that need has been another real sort of like just a programmatic challenge to wrap my head around. I'm public safety committee. I'm there all day long. Let's do it. I think that's a great idea. And we plan to be very present at these meetings going forward for the next forever. Because this is a thing we're doing together as a neighborhood. So yeah, thank you for your question.
Sally Fisher, please.
Sorry. That Tanya, Liz Ritter, and myself have actually seen the center, and it is beautiful and promises to get even better. I had one question for Kaylin in terms of funding. How are these programs being funded? And also, I guess for the city, there's a lot of pressure, I guess, on given the speed with which the program was introduced and the fact that the Department of Health didn't do the outreach that maybe you could have done. A lot came down on the corner project and the Harlem site in terms of, you didn't reach out to the community, et cetera. And my question to the city is, what can you do to educate the population about what these sites are doing and what your plans are for the future? And also, what can you do in terms of financing to make sure that we partner the prevention services and the treatment services with the overdose prevention?
I'll take the funding question, Michael, and then you can take the hard question. So the sites are privately funded. No city or state money is going towards these sites. However, I want to say, and I'm saying this in front of Michael and Chelsea, we're hopeful that changes. But for now, this is a public health intervention, and we hope that this can have a long-term sustainable funding source through the city and state health departments. But for now, it's private dollars. The rest of our programming is largely city and state funded with some foundation and private money as well. But the OPC is all private money.
Okay, great.
Go ahead, Michael. Good luck.
Yeah. Thanks. I will say that we do value kind of community input. We do want to kind of talk to folks, have conversations, educate. We are actually currently in the process of kind of developing a plan to engage and educate communities across the city, just in terms of what overdose prevention centers are, just in general. So our plan is to do some of that education kind of more broadly throughout the city.
Okay. And then my other question, I guess, that just came up with the person who asked about the Narcan and where it's available. I think you put some vending machines in certain 2 locations, maybe in the city. And I wonder what your plans are to put more of those vending machines throughout the city that would offer needles and Narcan, et cetera.
So are you referring to the public health vending machines?
Yes.
So this is very much in the very beginning of the planning stages. And so we really don't, we know what the kind of overdoses are occurring. And we're looking at kind of priority neighborhoods to think about kind of, where could they go? But it's still very early in the process. We haven't even chosen any CBOs or SSPs. And so therefore we want to really make sure we go through a thoughtful planning process, connect with those providers, make sure they're connected to the community in advance to see what the needs are. So we're very much in the very planning stages. That's I really can't even
Okay.
And I'll just add on to that, Michael, like as those are, as those roll out, I think another important thing, as you were saying, I'm sorry, I think it was Sarah who asked that question, the education component about, how will we address concerns about syringe litter, and explaining exactly, not just for the public health vending machines, but also for OPC explanation as well, explaining kind of what happens, what they are, the education around the city, and starting with community boards in general, which we've been kind of doing a little roadshow. We didn't do the deck tonight because Kaylin gave such a good introduction and I didn't think it was necessary. But, starting really with the data and why this is so urgent right now and what is happening in the city in terms of overdose. And, we have published, and I think the links are now in the Q&A now, 2020 data and also preliminary 2021 data that looks, just as bad, if not worse, in terms of overdose. And then going into explaining OPCs, what they are, why they are a benefit, and answering a lot of the thoughtful questions. I mean, many of you have had and may still have about kind of myth busting about what actually happens in OPCs, what happens in the surrounding community, how the city is supporting other concerns with our joint operations with the police and DHS and sanitation to ensure that community concerns are met. I think all of that is really important education. And if you all have suggestions about other things that we should be including in that education or Q&A type, myth busting, we are more than happy to take that feedback. So thank you for that question. It is exactly what we are trying to do.
Right. OC Canada.
Yes, hi. So I'm so happy to hear all of this. I mean, I think it's a wonderful program, and my thinking before you guys spread out to Brooklyn and other areas, I just wonder if the Washington Heights Inwood can get another facility. I know the one, I mean, like you have like 6, what do you call them, stations in that one. And so do you know where those individuals are coming from in terms of the street address? Because I'm just thinking about how long would individual travel to get to a place to take their drugs. So if we have only one on 180, I'm sorry, I'm spacing on the address, 181st?
180.
180 what?
180.
Okay, 180th. What do individuals do if they are on Nagel Avenue? Will they travel? Probably not. And this is kind of related, Steve, to what you asked before, that some of them are probably getting overdosed on the street and we don't really know about that until they're dead. So I encourage you guys to think about another facility, even small as 6 stations in an Inwood or even a border with Inwood and Washington Heights, but one more in our district before you guys spreading out to Brooklyn and all the other places. I just want to say that something similar to that, but no, I don't know if it still is, but back 30, 40 years ago in Switzerland, they would have like a safe needle program. They'll have trucks in the parks, and this is how they started the program, because they have a really serious drug users in Switzerland. So it's somewhat similar, except that there they had trucks and they would provide with needles and so forth. So maybe temporarily, can we have a van somewhere providing with similar, like similar services you guys do, but on a van, maybe with 2 or 3 stations? I'm not sure, something to start. I'm really happy that this program is available. I'm thrilled.
I really appreciate you and everything you said. And I visited the site in Switzerland. And I don't know if you know this, but you should, so you can be proud. The very first safer consumption site in the world was in Switzerland, and it opened in 1986 in Bern, Switzerland. And it's a beautiful program that still exists today. And I am in touch with them a lot because they're pretty special folks. I mean, I say yes to all of that, but yes vans, yes more sites, yes, yes, yes. But I think it's it's a little bit of a longer process, and I see Michael and Chelsea taking lots of notes. But it's really just great to hear your cheerleading for the program. That's just, I want to thank you.
All right, to Tanya Bonner.
Hi, I'm sorry. Hi, I'm sorry about that. Can you hear me?
Yes.
Yeah. First of all, thank you so much for coming to present to us. I really appreciate that. We've been waiting. And I did appreciate you all inviting us to come and see the facility. It was wonderful to see that. I have a question. My main concerns, and I remain around, educating people and about outreach to the community. And I guess I have a question for the Department of Health in terms of what happened where that didn't happen. Because I think one of the problems is when we come and we back into it and we say, okay, we kind of do it backwards, and we say, okay, now that we've done this and set it up, now we're going to talk to the community about it. And it needs to be the reverse. So I think, and it just hurts, I think, trust between, everyone in the community, right? So what happened, that did not occur in advance? And I'm also just concerned about, what that's going to look like in terms of, and how much input, you're going to get in terms of the type of people who you're reaching out to. You're across the street from a park that has its own issues. There's a development that's coming across the street that's going to have its own issues. But there are also many other places around, right? So I just don't want to see you all enter into a situation later where people are now like, there's opposition where it doesn't need to be. And so I would like to just kind of dissect a little bit, even if, like what happened, where the lapse was in terms of understanding that the community needs to know about this in advance and not after the fact.
Yeah, I actually wish I could completely answer that question. It's a great question. I literally came into this role on the day after the OPC opened. I do, and so I was not there for kind of all of the kind of that period, that lapse period. But what I can say is that I think we're very much committed to engaging community on all levels. And I can definitely appreciate kind of you not just focusing on community boards, but other sectors and types of community as well in the process. And we want to do that. And so that's part of our processes of doing the education, kind of letting people know. I mean, we do know where these areas are. If you look at a density map, we know the areas that are mostly affected by overdoses. If you look at the density maps of the city, kind of those darker blue, I wish we could pull it up, but you see these kind of darker areas of the city are the areas that also have the worst health outcomes, the worst mental health outcomes, higher incarceration rates, highest drug, ED calls. I mean, there are lots of, these kind of overlapping kind of problems. So we know where they are just based on our surveillance. So I think it's about having conversations and thinking critically about where the service is needed. And also another important part is that we want to make sure that the providers are good neighbors and that they're going to work in tandem with the community as well. Like it's, you don't just open up an OPC, just open up an OPC. You want to make sure that the providers are ready and able to take on that challenge. I mean, I think Kayla can probably speak to kind of how big of a lift it is to kind of pull this off. So we want to make sure we have the providers who are ready and able to do it. So that's kind of, so it takes some time.
I'll jump in.
Okay, go ahead.
I do think there is some confusion. So as much as y'all can help us clarify that now that we are after the fact, that the city isn't just, going into neighborhoods and saying, we are going to place this thing here and kind of like cite out of the blue. these are, as Kaylin has been talking about, they're not run by the city, and we are working with existing providers for this very reason, because providers have existed in the communities for many years and know the community, and not just coming in out of the blue with no relationships is actually, it's quite important. And so in East Harlem and in Washington Heights, I think that was really critical to the success that they've seen, and it is all thanks to Kaylin and her team and Sam and in Harlem as well. So I will just say that I do think there's some confusion about kind of like how that we're just kind of picking random locations and putting a building there. And I know you all know that's not true, but that is not what's happening.
Yeah, and I listen. I've known Kaylin and the team for a long time. I have total faith. I know the passion and the commitment from Kaylin and her team. I that is never in any doubt or question. Okay, I can tell you that. But please be prepared. I think if you don't know the answer to the question about why the community was the last to know, you're gonna need to answer that question. Okay, in whatever forums you end up doing, that question is going to continue to come up, right? It's not just about the community board, right? But the questions are going to come up. And I think that you all should think about that question, like where that lapse was, where that lapse was, and where and how, what the answer is. Because people, even though I know and we know that there's been some services, these services being provided, right? Before this was official, right? But the community, to have people say this is now official, announced by the city without any kind of input is really something that took people by surprise, right? So people, I just think sometimes what people do is they want to move ahead. Well, let's just move on. Let's just move forward. You got to deal with what caused the lack of trust, right? You can't just move forward without addressing that question. I think, and believe me, if people will appreciate that level of accountability and transparency, right? And then they could, go on this next journey with you. But because I was even shocked, I'm just going to say, I was really surprised to learn about it the way I learned about it, right?
Let me just interrupt for a moment here, because I think the fact is, looking at this in retrospect, Dr. McRae's predecessor, Dr. Cunningham, came to our committee in November to talk about harm reduction and overdose prevention. And looking back on it, it now seems as though she was setting the stage without telling us. And I wish she had told us at the time. I wish she had been maybe upfront back then. But it seemed as though the reason she came to our committee was to lay the groundwork for the opening of the OPC. I mean, because why else did she suddenly decide to come and talk to us on that subject? And then the OPC opens up just a few weeks later. So I'm not casting any aspersions, but I think it might have been helpful to speaking to Tanya's point, if maybe we had known at that point what was about to happen. But listen, now it's a fact, and not that we need to live with it, but we have to make sure that in fact it is responsive to the community needs, and that it's operating properly, and that it's doing the job that it was meant to do. Let me.
And Steve, can I mention one more thing, and then I'm going to shut up forever. I promise.
You really promise.
I do promise.
That's
I
not
swear.
true, Tanya.
I will say nothing. I will say nothing. Oh, you all asked for other areas in which you all could do education. I think there is a need when you're doing education to also do equity and training around this, because I think that people can approach the clients and the people who use your service in an incorrect way, speak about them in a way that's offensive, that is discriminatory. And I think that kind of focus in one of the conversations needs to be a part of it, and how we talk about people who have addictions and how we approach them and how we interact with them. And I think that is going to be something that probably the community could benefit from, maybe some education in that, around that arena, business owners, whomever, right? So it goes both ways. We have to be good neighbors, right? As well.
Okay, let's
Thank you.
Thank you. Thank you.
Maria Luna is on, it's in the participants,
Okay.
so she needs to be promoted.
Also Diane Ashley needs to be promoted, Paola. Jay Mazer, please. Natalie, we'll get to you next.
I was just going to say, on the question of local residents complaining about people from outside the neighborhood supposedly coming to the safe injection center. That's besides the point. I was born and raised in Washington Heights, lived here most of my life. And since I was in high school, I've been aware of people coming to Washington Heights to purchase drugs. And I'm quite sure this has been an issue since the George Washington Bridge was built. If you look at where the other safe injection center is, in East Harlem, anyone who was ever a rock and roll music fan, at least since 1967, was aware of the situation on 125th Street and Lexington Avenue. So the problem is not people are coming to our neighborhood or East Harlem for the purpose of injecting drugs, but that people are coming for the purpose of purchasing drugs. And the fact that they are, in some cases, doing that doesn't mean they deserve to die on our streets. And I don't think any more people would be purchasing drugs in the neighborhood because of a safe injection system at all.
All right, point made. And at some future meeting, you'll tell us about your rock and roll experiences on 125th Street. Natalie Espino, please, representing Borough President Mark Levine.
Yes, good evening, folks. As always, Kaylin and company, an extraordinary job, such important work. I know that you were really laser focused in your presentation, but I think it would help to, for folks to hear at whatever point it's appropriate about, things like the school partnership with Wheels and the shop plan. And I would just add to, some of the comments already made about the outreach. You have a cab, I go to those meetings. It's great. I think that in addition to just kind of speaking giving people some of the language, if you could just create some kind of a Google Drive with a toolkit that has materials in 2 languages, that could be just like easy guides. How do you, you support this, we get that it's necessary. Now, how do we communicate to neighbors what the purpose of this is, why it has to be where it is, and what would be, what we're trying to prevent, what we're trying to not have happen if you guys weren't there and we saw it when you guys were homeless, that how scary the situation got. So just it sounds very, very modern for someone my age to ask for these social media toolkits, but they are very effective and they help your supporters and even people who are learning about and getting educated get that messaging.
All right. Yeah. All right. Thank you. All right. I think I don't see any other hands. Sally, are you? Okay. All right.
My hand's down, but you still need to promote, I think, Maria Luna and the other person.
Yeah, it has to be for Paola. The rest of us don't have
right. Paola isn't here. I think she left.
I'm sorry, who left?
Steve.
What?
I think it's up to you to promote them because I thought that Paola said that she was leaving.
Oh, no, Paola's still here.
Or
I think
Steve, if you
Tanya
want
has
on my
some,
name,
Tanya
Sorry.
has some. Go ahead.
just real quick, Steve, if you, no, she doesn't have it anymore, Steve, because if you click on mine, and basically just make me a co-host and I can upgrade Maria.
I've been trying to do that. The request has to come from her. She has to acknowledge it. Maybe she's away from the computer. I've been literally pressing on the button for like 2 minutes straight and I can't get her over.
All right, well, I think we just have to move along. All right, we have 5 participants who have raised their hands. Hold on a second.
She's
That's
here already.
All right, I see 3 participants who have raised their hands.
Steve, I just wanted to say the Q&A has a bunch of questions, but they're really similar to what Natalie posed for Kaylin. So I think perhaps some of that might already be answered if Kaylin's allowed to speak.
Okay, well, there are 3 people I see in. I see there are 2. Okay, there are 2 panelists and 3 attendees who have raised their hands.
I just want to make sure that the outreach is not just directed towards the responsibility of the Coroner Project, but that's something the city needs to do through the Department of Health.
Well, they probably.
So actually, I can't say that we actually do have outreach. We are doing outreach in the area and escorting people to the center. Yes.
Great.
It's part of our joint operations and work with DHS and Health and Hospitals and PD.
And in terms of communication, maybe stuff in the subways, on the trains and stuff, because there's a lot of action in the subway system, apparently.
All right.
Am I
Apparently,
allowed to talk? Can I just answer that? Is that okay?
yeah, do it quickly.
Very, very quickly. Okay. So I just want to introduce Jason Beltray is here. He is our Director of Community Initiatives and Impact, who is running our CAB. And Jay manages our outreach and public safety team. And we're working with the MTA to increase services to the A train and 1 train subway station, as well as installing a couple more kiosks in Highbridge Park. The health department has been amazing in helping us shore up outreach when our building is open, and they've been particularly responsive to being in the neighborhood when we're closed, which is a huge need as well. To Natalie's point, we have tried hard to diversify our service portfolio and position ourselves as something other than just a harm reduction service provider. So the building that we have on 180th, we have a 30-year lease and we have the entire building. So the ground floor, we're turning into a social enterprise, a laundromat and a cafe that employs, creates jobs for our participants. So doing some workforce reentry. And we're trying to provide a service to the new development that's going in across the street from us. So rather than be at odds with them, we're trying to be a service to them. Beyond that, we're putting a green roof on the building that will be tended in partnership with schools on the 182nd corridor in sort of an urban agriculture program. Growing foods alongside some of our program participants. Will be doing another workforce reentry initiative through the garden, and then jointly coming together to serve meals to the community. As you know, we're hosting the community fridge, La Nevera, that used to be on 183rd, is now in our drop-in center. And that's another, we were so grateful when the Nevera people reached out to us and said, do you want it? We said yes, because it's another way that we can be seen as a community partner, not just that syringe exchange. So we're trying hard to shift the perception of what we do in the neighborhood, and we're trying to do more in the neighborhood to be seen as a valued organization in Washington Heights.
All right, we have 3 other people who want to ask questions. I think this is maybe Bernard Grobman.
Yes. Yep. Okay. So first of all, let me say that I am a recovering drug addict and alcoholic. I've got 36 years of sobriety after having used for 18 years every kind of drug you can imagine. Okay. I never wound up on the street. I was kind of a high functioning guy, but it still messed my life up. If somebody had offered me this kind of program rather than saying, hey, you got to stop, I don't know. I don't know where I'd be right now. I'm glad I had to stop. I don't see how a situation. Now, I understand that you're trying to save people's lives, and it's very well-meaning. Okay, very well-meaning. But that continuing to let people use and enabling them. I mean, if you would have given me a spot where I could use whatever I wanted to use, and there it is, I might still be using. Well, I wouldn't be alive right now. I probably wouldn't have made it this far. But because there's all sorts of other things that will off a drug addict or an alcoholic, besides an overdose. So there's life situations. There's all sorts of stuff that people get into, and I've known lots of people. I've known a lot of people who have gotten sober and clean, and I know people that were using a lot of drugs and they lived in Brooklyn Heights, or they lived in Park Slope, or they might have lived in Forest Hills. So I have a little bit of an understanding as to why these two locations were picked as the first two sites. I believe that the city was trying to open sites for several years and couldn't get around the legality, and decided to backdoor it into the clean needle programs, which were already there. And you can correct me if I'm wrong about that, because obviously this is third-party information that I have. But it's also the reason why they couldn't get them open is because technically they're illegal. Technically, they're actually illegal. They've been trying to open them up in Seattle and a few other cities, and they can't get them open because of that. So the question is, now I understand there's no city money going into this, but how is it city sanctioned, especially in a situation in which you were actually running it before it was even sanctioned? Because that you're basically running, in a sense, an illegal operation of letting people use, or knowing that you were letting people use illegal drugs in your site. And once again, I say I understand the well-meaningness of this. I get it. I just don't see how it helps either the poor people who are suffering from the disease of addiction or the community at large. In the end,
Okay. All
Anyway.
All right, Bernard, let Taylor answer your question.
Okay, I feel like this is sort of unfair because you don't have your camera on, but I want to tell you, BJ, or BG, I'm not sure what Bernard, I think it is, that if you were using our site while you were in addiction, you would have survived, because that's what, so you said I probably would have been dead. No, you wouldn't. You would have been with us. You would have survived. That's what the site does. And the site doesn't enable drug use. The site acknowledges drug use. So this is not a site for somebody who is experimenting. That's not who these sites serve. These sites serve a very particular population with chronic and relapsing substance use. We're talking people that have been dependent on substances problematically, as they define problematically, for 10, 15, 20, 30, 40 years. These are people who have been in and out of treatment multiple times. These are people with unaddressed trauma and mental health issues, often underhoused, often excluded from the medical system, histories of incarceration, transgenerational trauma, you name it. This isn't sort of like Aunt Tilly on a Sunday afternoon who has a G&T and a benzo.
Listen, I know people that were through all of that, and they went through 12-step programs, and they wound up fixing their lives. Okay, so then they
totally get it, and some of our folks do as well, and some of our folks don't.
You're talking about people who've been through programs that create abstinence, and you're talking about them as if they're hobbyists. I was not a hobbyist. Okay, I ran away from home when I was 14. I was using drugs on the street the whole time. Okay, I was not a hobbyist. and the damage that the cocaine did to my heart manifested itself in a heart attack eventually after I was sober for 20 years, 25 years. So the damage gets done, and then it's sitting there. So I was serious about that stuff, and I know plenty of people who are in and out of facilities, mental institutions, homelessness, everything, and they got sober, and they were not hobbyists, not hobbyists.
Understand.
So I know there's a lot. There's anyway. I just so to couch it as though I'm some kind of a hobbyist.
I'm not saying you're a
Yeah.
hobbyist. I'm not saying you're a hobbyist.
Or
What
the
I am
people
saying
that I
is
know
the
are.
highest rate of overdose fatality is for people coming out of abstinence-based programs who return to use. And that's where we come in. We are not an enemy of abstinence. We are a partner of abstinence, and a very important partner. We are the net for somebody who returns to use, whether they want to or not. We acknowledge that 98% of people who are problematically addicted to substances have some kind of what is sometimes referred to as a relapse. We call them a return to use. 98% of people don't get sober the first time they try. That's where we come in, because that is the highest likelihood that a person who returns to use is not going to survive. These sites are about safety, stabilization, and saving lives. And that's all I'm going to say about it. And congratulations on your years of sobriety.
All right. Thank you. Joel Keys.
Hi, guys. Good evening. I am part of the community board, land use committee. My name is Joel Keys. I just have a quick question. I totally understand the strategy behind these OPCs, and I understand that this location particularly was chosen because of the usage. I get the strategy, but I'm going to focus more on the finance. So this is there's no government spending here. So is this a 501(c)(3), and I do have a follow-up question. Is it a 501(c)(3), and is it for profit, this business, and who owns these centers?
Great question. I saw your questions in the chat, and I'm really glad that you brought them forward. Who owns the centers? Our landlords own our centers. We have 30-year leasehold condo agreements for both buildings. So our landlords own both buildings. The city does not own buildings.
Well, when I say obviously the actual centers own the actual property, but who's leasing them? What is the name of the company leasing this property?
We have the name of the company is the Washington Heights Corner Project and the New York Harm Reduction Educators in East Harlem.
And is this a for-profit entity?
It is not.
Is a 501(c)(3).
Sure is.
So just to address my follow-up question, and was outreach done prior? I understand that there's outreach being done now, right? And obviously, after it's built and after you guys establish that center, I mean, outreach for what, honestly, right? So whether we like it or not, it's there, right? The opinions don't matter at that point. But was there outreach done prior to these centers being there?
Yes, there was lots of outreach done. The Washington Heights Corner Project has been doing outreach in the neighborhood around overdose prevention centers for 6 years. The health department did their own outreach, but I'm speaking just on behalf of the Washington Heights Corner Project. As I mentioned before, we were running an unsanctioned program that the NYPD, the 33rd and 34th precinct and the 30th precinct knew about, as did the elected officials in the area. And we've been advocating for the standing up of these sites for a very, very long time. So the short answer to your question is yes, there's been a ton of outreach around these sites.
So I'm a relatively new, I'm a new member in the board, and I can tell you, I've been living in Washington Heights. I'm 30 years old for 30 years, and the majority of the sentiment, the people that I've chosen to talk to and to hear from, do not like these sites. They don't think they prevent drug use, and I'm just here to advocate for them because I know that the strategy does work and it has a history of working. but it doesn't reflect the sentiments of the residents of Washington Heights. And I don't know if anything could be done about it, which is very sad, right?
There is
But-
something that can be done about it. You can invite those folks to come and see the site. So again, there's a standing invitation for anyone, particularly people who don't think that they're in favor of the sites or have questions or concerns. Those are really the people that we want to have come and see the site. I'm less interested in preaching to the choir. We as an agency want to talk to people who are not in favor of this, who don't understand this, who have serious concerns. So this is, I'm putting this on you now. I need you to gather those people. I'm going to put my email in the chat, and we need to arrange a time for you to come and visit the site and meet in person, see the services in action, meet the staff, and then continue this discussion.
I like that idea. That's actually a great idea. But just last question, and I promise this is my last question. What are we doing? Because I believe his name is Bernard. Bernard, I congratulate you. There's drug use in my family, and that's tough. You're a warrior. What are we doing to like the health drawbacks, the implications of after using in this center, they're gonna have serious health conditions. What is this center doing to prevent that, to help these people for long-term effects of the drugs?
I need a little more information there. What do you mean by health problems?
So I imagine using these drugs have long-term effects, right? I mean, I would assume. What are we doing to prevent that, right? And is it something that you're making them use, or not making them facilitated for them to use in the short term? Or are they going to be here for 10 years, 15 years? And if so, have you guys looked at the health repercussions of them using for so long? I don't know if you understood.
Yeah, the repercussions of long-term drug use have been intensely studied. Harm reduction as an intervention is one part of the solution. Prevention, treatment, further education, enforcement, harm reduction, those are all pieces of the pie to address what's happening in terms of drug use. And speaking just for Washington Heights, in Washington Heights, we are one part of the solution. We are not the only part of the solution. As I mentioned before, these sites are really working with a population who is at high risk of overdose fatality. We are about stabilization, safety, and preventing the loss of life. We have a saying in this line of work that says, where there's breath, there's hope. If you don't survive an overdose, you cannot get sober. If you don't survive an overdose, you cannot get medical care. You cannot get a job. You cannot reconnect with your kids. You cannot go to treatment if you die. So this is really about preserving life. As I mentioned earlier in the presentation, we have healthcare services on site in the form of a physician's assistant, a registered nurse, and a social worker. We also have long-standing, very good partnerships with New York Presbyterian Hospital, Mount Sinai Hospital, Montefiore Medical Center, where we are constantly referring people for medical care. We have very well-established partnerships with long and short-term treatment programs, abstinence-based programs, recovery programs, and detox programs in the New York State area, as well as other places outside of New York State, acknowledging that sometimes people really need to get out of their roaming territory to have the best chance at maintaining sobriety. So just want to recenter that. We are one piece of the are not the only piece in the puzzle to addressing the very complicated issue of addiction in America. We play a very specific role at a very specific level.
I thank you for that answer. And Joelle, I hope that you'll report back to us after you visit the center and let us know what you how you may have found the place.
Colin, can you put your email address? I would like to visit the center as well.
All right, I think the last person to ask the question will be Marina Beal. Marina, do you have a question? I think
apologies, wrong name. Gabriella Beal. Hi.
Okay.
I think the OPC. I'm a Dominican, born and bred here in Inwood. I think the OPC is a godsend. I've had family who have been ill with drug use and who have passed away because of drug use. I think, and I've also volunteered at the New York Presbyterian emergency room and have seen folks who have ended up in PR and essentially in very, very bad shape and just go back out into the streets without any support. So the OPC, with its physician's assistants, with its social workers, with its caring nature, treating their clients like human beings is a godsend to our area. I've been here in this neighborhood and seen what the open drug supermarkets have done. There's a lot of consumption. There are a lot of folks out there on the streets, and unfortunately they can't help themselves and they find themselves in a McDonald's openly injecting. So to have an OPC where they have support, where they can get help if needed is fantastic. And I hope we have another center here up in Inwood. It's much needed. So hats off, it's incredible. And I hope you get city and state funding. And my family, a bunch of Dominican Americans, hardcore conservatives, are very happy that you're here. So thank you for literally doing God's work. Now, my question is to the DOH, Narcan, and having I think it's called Suboxone injections available for people in our community. Narcan, I've tried to get some of these rescue kits, and I was told, well, you can go to any of your community centers. It's not easy to get. Or go to your local pharmacy. Only CVS on Dyckman carries it occasionally because they get whatever they get from, I think it's the Department of Health, if I'm not mistaken. So we have a huge medical center with two large facilities here. We have the Department of Health, which has an office at 168th Street. We need these resources. We need to get the Narcan. We need to get it quickly. We need to get this information out into the neighborhood. Where can you get help? Where you can get Narcan, where you can get the Suboxone, I think it's called, injections. You get it once a month. You untether yourself from going on a line to get your opiate meds. It's a fantastic thing. We need to educate the community, and we also, if possible, go to the local churches as well. Some folks who are, you'd be surprised, they have lots of family members who are suffering and who are have opiate dependencies and need help, and to have a resource like you guys, and also to have the Department of Health and the city and the state to do their part, because they're essentially, we've been left to our own devices up here. So if we could get regular updates here at this committee, that would be fantastic. At public safety, that would be fantastic. I know that there's the city agencies show up once a month with the community board. They should give updates on what they're doing to combat opiate dependency in our neighborhood. We are going in a very bad direction. Every day I see more and more faces, some of them new, some of them not so new, who are in very bad shape, open track marks on their hands, arms, actually even standing in the post office line and seeing someone slumping over from what I believe to be opiate use. So it's getting to a critical point. I know COVID, the pandemic is really affecting us very, very much, but we need to do something. And I'm very glad that the OPC is there, and I'll definitely be going to the cafe. The work reentrance piece is very creative, and I'm thrilled. Thank you for being a partner. Thank you for coming to our aid. Much needed. Sorry about that.
Thank you, Gabriella.
All right, very good. Dr. McCray or Chelsea, would you want to respond to Gabriella?
No, I was saying I saw the question earlier in the chat, and what I'm going to do is going to circle back to this group with some information around access. So I do hear you. So let me kind of get back to this group around your question specifically in that regard.
And I know Ross Fromer from Columbia University Medical Center is on the call. And Ross, there was there was a doctor at Columbia who was providing the kits. A couple of years ago, we did a training at the community board, and she had the kits. She was excellent. I keep forgetting her name. But
at the nursing school.
Was it?
Kelly Bryant. who
Yes.
is
Yeah.
recently been promoted. I think her title now is Associate Dean, Assistant Dean at the School of Nursing. Please don't quote me on that. And she does a lot of things for us. She runs our simulation center, but she also has developed an expertise in training citizens, not medical personnel. She trained me in Noxalone, in how to administer Noxalone. It's something we do as every part of every project medical education. I will be honest with you, I haven't spoken about this topic recently with Kelly. I will double back with her. She like all of our other folks, got pulled into COVID and was working in the ER and the ICU. But I will go back and see what the status efforts are recently.
Yeah, please. And Gabrielle, if you could just stay in touch with us and maybe you could attend our meetings more often. We could certainly try to furnish that information to you because Dr. Bryant was really studiously going around the community dispensing those kits not that long ago.
And I will just, so hats off to, because I think she got the kits through a program with the New York City Department of Health and Mental Hygiene. So just, kudos, a partner in that effort.
Yes, yeah, we should not ignore that point. Yes, I believe that they came from the city. Well, thank you very much. Thank you, Kaylin, and thank you, Dr. McCray. Thank you, Chelsea. I'll be calling you on some other issues in the future. And I think we now have to move the agenda. We have a lot more to cover about COVID-19. And I appreciate the discussion, and I'm glad that we heard a range of opinions on this topic. I think
We sure did.
Chelsea, if you could send us the stack that you did present, that might be good for us just to look through in terms of educational materials for our community.
Yeah, absolutely. I will ask that Pauline will share it after the meeting. If not tonight, then tomorrow. Thank you all.
Thank you.
All right, but seriously, I think it's good that we heard from different people with different viewpoints on the subject. I think we all gained from that kind of a discussion. So let's move the agenda to our usual reports on COVID-19. And let me begin by giving an update on the latest statistics, which are pretty dreadful for the 4 zip codes in Washington Heights and Inwood. Let me just say, since we last met a month ago on December the 2nd, there have been 11,263 new cases of COVID in our community. So for the entire period of this pandemic, there have been 36,621. Just in the last month, 31% of all of the cases have occurred in just the last month, and 12 additional deaths. We now have had 835 deaths in the last since the beginning of the pandemic in our 4 zip codes. We are at a high transmission rate, 2,701 new cases per 100,000 over the past 7 days. That rate is above the rest of Manhattan, or Manhattan as a whole. It is under the citywide transmission rate, which is over 3,000 per 100,000, which is just incredible. Our vaccination rates, all 4 zip codes, as I've said previously, are over 70%. Zip code 32 is at 77.5%. Zip code 40 is at 75.36. Zip code 33 is at 73.82. Zip code 34 is at 73.31. Those are percentages for people who have had at least 1 dose. All 4 zip codes are under 70% for people who have been totally vaccinated. So the zip code 32 is at 68.53. Zip code 40 is at 67.19. Zip code 33 is at 65.94. Zip code 34 is at 65.52. And again, all of our percentages on vaccinations are significantly below the citywide average as well as the Manhattan average. Citywide is 82% for people who've had at least 1 dose. Manhattan is at 91%. So we're way below the rest of this borough. So those are the latest reports, but it's incredible that in just the last month, over 11,000 people in our community have gotten COVID. So with that, Pauline, the latest report from the Department of Health.
Hello, good evening, everyone. And I just wanted to just share my condolences about Betty. She really was a wonderful person. So I wanted to just underscore the importance of boosters. And so I don't know if everyone has the information as it pertains to boosters, but currently, if you are ages 12 and older, and in at least 5 months since your initial series of Pfizer, or 6 months since your initial series of Moderna, you are eligible to receive a booster. So starting tomorrow, Friday, most vaccination sites in New York, including all the city sites, will expand the boosters for those 12 and older. And as Steve mentioned, this variant, Omicron variant, is much more transmissible. So we are seeing increasing cases because of that. And so we really want to encourage people to get vaccinated if you haven't been already, and to get your boosters if you're eligible and within that time frame. So we really just want to underscore the importance of that. But in addition, to continue following all of the core 4 guidance. I think, as the pandemic has sort of lingered, people became very lax with the indoor face coverings and with gathering and with holidays, all of that. People really wanted to see family and felt that because they were vaccinated, they were sort of, just completely immune. But again, all of these really important guidance remain in place because they do work. And so, again, the city implemented the indoor mask guidance, and also for folks who Key to NYC initiative, which you're 5 and older, you should show proof of vaccination when you're in a restaurant or an indoor setting. So that continues. And unfortunately, because of the Key to NYC initiative expanding, we received our pest control team back, and then now they have now been reassigned to continue with Key to NYC. So a lot of our operations, when it comes to our bureau and program inspectors, they're now back to responding and working for Key to NYC enforcement. And so if there are any other non-COVID related complaints, unfortunately, we will be seeing some delay. But again, our teams are doing the best they can at the capacity right now. So those are all of the major updates. Steve, I know that you sent me prior to this meeting an inquiry about a testing location was run by the city, a cookie lab, 168th Street, I believe, right?
Yes.
I did inquire about that. So the DOH cookie labs were under authorization by the state for the emergency declaration for COVID. And so because of that, I think when it ended back in March, there were plans scaled down, obviously not foreseeing the Omicron variant coming. So I think a lot of our emergency staff that had been redeployed to focus on emergency work had been, reassigned back to their original roles. And so staff concern, and also just making sure that our STI clinic would be able to function in pre-COVID numbers. So I think what I need to do is just go back to our team to re-emphasize how important it is to have as much testing capacity in Washington Heights as possible, because we do know, and you and the committee and everyone else has been very, very, very vocal from the beginning about the lack of resources. And I have been an advocate to make sure that people who need to know that these resources have been requested, are really needed by the community. So what I'll do is I will find out more about what we can do to sort of reassess usage of the clinic at this point. I do know, and I'm glad that T2 is here, but I do know that they've ramped up a lot of their testing capability. And so I'm hoping, that we can sort of rely on them and their capacity right now to sort of pick up, unfortunately, what we had to close down at that particular site. So that's the unfortunate update. But again, I will do my very, very best to underscore how important it is for the community to have as many resources as possible. And I will hopefully be able to get back with better news at next month's meeting about testing capacity.
All right, I appreciate that, because that was the one site we had operated by the city that provided the PCR tests. And I think people had a very good experience going there. People were handled. It was done on an appointment basis only, and in the early period of the pandemic, it wasn't that difficult to get an appointment. Maybe you had to wait a few days, but you did get an appointment, and then you were in and out pretty quickly. You got your results the next day. It was very efficient, and it was a very important resource. And I could have sworn that when I tried to register recently on the DOHMH website, that it was still listed as a potential site, as an operating a site still in operation. And but of course, the appointments never popped up for that location. So it would be great to get it back in. The site at Highbridge is just a rapid test site, doesn't do the PCR, and I believe a lot of people would like the further reassurance of getting the results from a PCR test. Mary Anderson, you have a question for the health department? Mary? All right, we can come back to Mary. Sally?
Yeah, I think that people also need the at-home testing kits. And Steve, that's one of the things in terms of your numbers. I think they probably are low in terms of what the incidence of the disease is, because it doesn't include people who've tested at home and tested positive. So I think our rates are probably, in terms of how many people are walking around with COVID, are probably a lot higher than what we actually see from the data.
You're probably right.
Steve, can I maybe make a suggestion? I go through also my presentation, and then we can do Department of Health and Test and Trace answering the questions, because I think a lot of them overlap.
Very good suggestion. So let's turn it over now to Fernando Brigidi, the Manhattan liaison, I believe, for Test and Trace.
Thank you. I'm going to go through a few slides really quick. I'm going to be brief, because some things you already mentioned, or Pauline already mentioned. Can you see my screen?
Yes.
Great. So just a few updates from our end, the Test and Trace team, the outreach team with Test and Trace. So the mayor announced an additional 2 million KN95 masks to be distributed, in addition to the ones that we were already distributing last year. This is something that we do partnering with community-based organizations, faith-based organizations, community board members, PTAs, PTOs, because we know that against this variant, the cloth masks are not safe enough. So we're encouraging people to use high-quality masks, and we'll be helping do this with this distribution. The boosters were already mentioned, people age 12 and older. In terms of testing specifically, I think it's important also to highlight how in the last 3 weeks or so, the city expanded our own city-run sites. We're now in more than 200 locations. I was here last month, in the beginning of the month, we had, in terms of demand, around 17,000 tests were completed in city-run sites, which was 19 of the total demand. And we all know there was this new wave and a lot of demand, so we expanded quickly in a short amount of time. We're now doing 50,000 tests in city-run sites. This is the number, obviously, from December 20th. There's a lag with the updates on that. But it represents, we expanded how the city is meeting this demand, and we're now doing 35% of the total tests, including all the private providers and others. The other update that I think it's important also to highlight the good news and the milestones that we've come so far is that now 6 million New Yorkers are fully vaccinated. The next one, I think I can send this by email if it's easier, but just to highlight some things that the outreach team is doing to talk to people about the safety of vaccines, the efficacy of vaccines. There were a lot of questions in the last couple of months about children's vaccines. So we sent more than 49 million emails with information, including our newsletters and all of that. And the one that I want to highlight is this almost 8,700 events. These are small, really localized events in every neighborhood in the city, in all 5 boroughs, that we do partnering with community members and with community organizations and local leaders. So these are sometimes events that have like 5 people, 12 people, 20 people. So we're really trying to meet those 9% in Manhattan that still haven't gotten their first shot and try to explain to them, understand where the hesitancy is coming from. And also at this point, also reminding everyone about the need for boosters. We need that 2 shots are not, we need, in addition to the 2 shots, to be completely safe against the new variants, people need to take their booster shots if they're eligible. I think you already touched on this. I think I also want to, I know the zip codes from this community board area are lower than the rest of Manhattan, but I also want to highlight that I remember from last month, there are some of them also almost had a 10% increase, which is a good increase. It means like the work that you all been doing with your communities has been it's been helpful, and people are more and more taking the vaccines. In terms of positivity rate, I know the map looks here that Manhattan is a little better than the rest of the city, but overall it's extremely high everywhere. And in the 4 zip codes that we're talking here, again, extremely high. I think this was mentioned before. I want to emphasize high quality masks, social distancing when possible. If you're going to a family gathering or community meeting that it's in person, make sure that you get tested before and after. And if you're feeling sick or under the weather, stay home and try to social distance from others. One thing that I want to touch on, because we've been getting also a lot of questions, is what do people do if they test positive? So the city has a program called Take Care program with a number of resources, and I'm going to send to Steve the links on how to access this. But just an overview, if you test positive, even with one of those at-home tests or your own test that you got in a pharmacy, you can call the city 212 COVID-19, and one of the options is to talk to what would be similar to a case manager. They will go through with you the steps to access food delivery, how to navigate paid leave from your employer if you have medicine, health insurance, and so on. So I think this may be a good resource to share with your networks. A lot of people don't know exactly how to social distance, what are the quarantine resources the city has. So this is something that it's important to, at this point, we're getting a lot of cases to share with people. And then I'm gonna put my contact information in the chat as well for people who may have questions moving forward. Just related to the KN95 mask, as I mentioned, we are doing this partnering with communities, the distribution. It's a good number, but it's important that we're spreading and we're reaching all those people that need. So if any of the organizations that you guys work or volunteer with, you can request us to request a pickup and go pick up KN95 masks and other PPE supplies. Thank you again for the invite, Steve. I want to be really brief with my slides, so I deleted a few as we were talking because I didn't want to be repetitive, but I have all the time that you guys need to answer questions now.
I appreciate that, Fernando. And you will send me the PowerPoint so I can circulate it to all the committee members.
Yeah, and I'll also send, in addition to the PowerPoint, a longer PDF about the Take Care program that has more information.
Very good, thank you. Now, could you go back to the second slide for a moment? Are you saying that 50,000 tests were all done on December the 20th? No, this one, yeah. 50,000 tests on that one day?
Yeah, it's the test capacity.
On one day?
I have the information as one day. I know it sounds a lot, but I can double check for you.
That's incredible.
Yeah.
but all right. I mean, we have the testing site at the Highbridge Recreation Center. I wonder how many people they're doing each day, but
So I remember that one was one that in the last meeting, it was, I remember we discussed that and it was closed. And now it's one of the sites that we reopened because we know that there's the need and there's the demand.
Right, but there's always as far as I know, there's always a very long line there. Which only I think speaks to the fact that we need more of a testing capability up in this community.
Yeah.
And I wish you would help with Pauline look into the possibility of reopening the site at the health department building at 168th Street, 600 West 168.
Yeah, the same way we did with Highbridge, we can do it for that one. And I also want to highlight that community organizations can request a testing team or a mobile vaccine and testing site, one of those vans that we have. Today, I spent the day in a location in East Harlem. They requested a rapid test specifically there because today there was a lot of events going on around the Three Kings Day. So you can also tell community members and community organizations that they can request to us. And we've been able to accommodate most of the requests recently, even with the surge.
We did receive a notice that I guess one of the mobile vaccine clinics is going to be at CUNY in the Heights up in Inwood for 5030 Broadway, which I believe is 214th, 215th Streets. Is that correct? And it'll be there on Monday, January the 10th, Tuesday the 11th, Wednesday the 12th, Thursday the 13th, the following week, Tuesday the 18th, Wednesday the 19th, Thursday the 20th, 8 a.m. to 6 p.m. And it will offer the Pfizer and the J&G vaccines and boosters, and as well as the PCR and rapid test. And it's open to the general community. And people who are getting their first dose will also be entitled to the $100 incentive payments. So that's good, but we need more of that in the community. To Tanya, you have a question?
I wanted to ask you all about the testing. Are all of the mobile units, are they all affiliated with you, or are there some private operators that are not? The reason why I ask is because, I've heard people saying that, they went to some units and they didn't get their tests back, or it took like a week or whatever. So I just had a question about that because I don't know how all this works, in terms of who's, authorized to provide the testing. And then, what are about some of the issues about people waiting a long time to get their results back?
Yeah, so there are some private providers as well. Most of the ones that you see that have a van that says H&H or Health and Hospitals are the ones that are city run. We have some providers that are partnered with us that we know that sometimes that it's not clear that our logo should be there as well. So the best way is to answer, or I can send. Did we lose her? Oh no, here. Your face moved. You can also go to nyc.gov/testing, and you get the information there. And this is a link that I can send you all also by email at the end here. In terms of the long wait for results, there might be, obviously the average wait is a little longer than it was a month ago. But if there's a specific case that is that is too long, you can call also 212 COVID-19 and ask them what the situation is. We have different providers, so depending on the provider, we can reach out to them to ask. And in this specific case, also, Steve, you can also email me, or any of the members here can email me. Sometimes we can ask the provider specifically if we know which provider was there on the day that the test was taken.
Do you recommend that people use Health and Hospitals, or are people okay to go to some of the other providers? Is it something that you all say you might?
I recommend people using Health and Hospitals. On December 22nd, I went to the Highbridge location to get my own test. The line was a little over 30 minutes, although it was very cold and windy. And I got the results. It was a rapid. I got the results before I got back home. so the results were already in. Health and hospitals never, it doesn't matter your immigration status, it doesn't matter if you have insurance or not. So I strongly recommend health and hospitals. And I think Pauline also unmuted herself to add something.
I do too. I do
absolutely-
too.
Yeah,
I do
I
too.
mean, I would say that I would recommend all the city-run sites and the city-sponsored sites with H&H and T2, only because you know that you could reach out to Fernando or I should there be a problem, right? With more private-run sites, they're overseen by the state, and so we'll have to get in contact with the state. We'll have to figure out who this provider is. We'll have to go through that whole process. So we just encourage everyone, if you can, to utilize a city site, because you can just reach us anytime to get to a bottom of the situation. But also, if someone thinks that there is a fraudulent site, they should definitely report it to the New York AG's office. I will send that information to Steve as well, and I highly encourage you all sharing that with the community so that no one gets scammed. In case they unfortunately do, they'll know where to go to report that.
Very good. Because
Thank you.
really, I think a lot of these, what we read is that a lot of these private operators are making all sorts of promises, which they're not fulfilling, and people are getting very frustrated. They have no contact information. They don't know how to get a hold of them. The H&H certainly seems to be far more trustworthy.
Bingo, Steve. Thank you. Bingo. Yes.
We're not playing bingo today. Jay Mazer, please.
Yeah, I first of all, on the PCR tests, my understanding is there's an inordinately large number of false positives with them, such that many experts recommend, if you have a positive result from the PCR, that you take another different test to confirm. And on the question of fully vaccinated, does that mean being boosted as well?
Not my understanding right now is that the definition of fully vaccinated is only the 2 doses. The definition, as far as I know, has not been expanded yet. I think it will be at some point to include the boosters. Fernando, would you agree with me?
Yes, 2 doses of Moderna and Pfizer, or a single dose of Johnson & Johnson is fully, what we consider for data purposes right now, fully vaccinated.
Exactly, yes. Okay.
Just going back to your question from a few minutes ago, those 50,000 tests are on one day, yeah.
Wow, that's incredible. Okay, well, let's keep that up. Make sure they don't dip under 50 for the rest of the year. Where else do we have? Let me go to Maria Luna.
Hi, thank you, Steve. I was wondering if the rapid test can be done. We have an organization in our community called White Core, which is a consortium of all the senior centers. Is a possibility of getting them involved in obtaining the rapid test for the seniors, so they don't have to go online, on street lines and waiting, for hours, because people are talking about 15 minutes, not so. I have seen lines that are going for hours just to have those tests done. Also, getting the results is not easy for some people who don't have an email address or anything like that. So waiting for the results is really, it takes days. So is that maybe we can coordinate with the, the senior centers to alleviate the waiting, time for us, for the seniors. Is that someone, can address that?
Yeah, we can definitely do that. And I'll use the place where we were today as an example. In East Harlem, there was some questions there were some concerns from the community about questions about immigration status, and also people who may not have access to a smartphone with internet. So we did the entire process today in paper in front of one of our partners, and the results were given 15 minutes after the test right there. So the patient could just wait on the side. There were one line for those who were being checked in and one line for those who were waiting for results. So they would wait and leave with the results right away. I know there's some places that have really long lines with like hours long. What we can also do in your case, if you work with an organization that works with seniors, is you can request a specific unit, a specific team, testing team, to go, as I mentioned, this one that we were today, we can partner with you and do a pop-up testing site on one day for your community. If there's like an event happening or something specific date that you think would be important and helpful to be there.
And another question is about the new face mask, not the blue one that we see all over the place, but this new that is better protecting people. Are those being given out, or are they they have to be purchased? Because I think that some of the religious institutions that that have services on Saturdays and Sundays will benefit for providing those masks to the to the parishioners. So maybe that's also have to be taken in consideration if there is a expense attached to having this new mask being way. And some people are talking about that this is a business deal as opposed to really protecting people. I mean, we need to be clarify what are the benefits of changing from one to the other.
Okay, Fernando already pointed out that Mayor Adams has announced the distribution of 2 million masks.
Additional 2 million, yeah.
Masks, free
yeah, but where are those million
That's
masks
the
going to
question,
go?
is where. I think those are going to schools primarily.
So this we have a separate program about tests and masks to schools. These 2 million that I'm mentioning are specifically to community partners and community organizations. So all of you can email me and we can get the name of the organization, how many people you work with, or if there's an event happening, or if it's on the Sunday at church, and we can provide those masks for free. So there's some places that you can purchase, obviously, Maria, but the city is distributing for free. We think that affordability should not be an obstacle for you to be safe and for your community to be safe. So that's one of the reasons why I'm here also, so you guys can know who to reach out when need, and the city is distributing for free.
All right. Thank you, dear.
Mary, we can work together to send Fernando's information to all of the senior center directors. Let's encourage them to contact Fernando, arrange for testing, and arrange for the free distribution of the masks to their members. We have a very solid network, as Maria mentioned, of senior centers in Washington Heights and Inwood, and they would be a great vehicle to use for this purpose. But I'm sorry. Oh, Mary also has her hand up. Mary, you have a question?
A couple of questions. I wonder if Fernando, you could put your email in the chat in the Q&A as well, because I missed it. Quickly flashed on the screen and then it was gone, so I didn't get a chance to write it down.
It doesn't give me the option to.
That's one thing.
To add a question.
I can send it to you, Mary.
I'm sorry?
Mary, I can send it to you if you have a problem writing it down.
Okay.
All right.
That's one thing. Okay. The second thing is that people have talked about these vans. I was tested at a couple of times, but one van that I tested at a week ago Monday, I'm still waiting for the results. That's 10 days now, and I've heard nothing. And there's a phone number associated with them, and you call the phone number, but they don't answer. So that's an issue. But the H&H vans, I don't know where they are. I haven't seen one. Is it possible that we can get a listing or some kind of information as to where they are?
So Steve, I think it would be helpful. I can send an email with kind of like all the notes from this conversation. And if you can share with the group, there's a link that you can go or a phone number that you can call, and you put your zip code and it'll tell you all the locations in that area that you can get tested. And it shows the ones that are age and age. I think that's the easiest way if you have access to the internet. If not, you can call the number and then they will let you know.
Yeah, because I've seen different listings and they list places that aren't even open anymore.
Isn't there a flyer that that's being distributed each week with an updated list of the testing and vaccine sites?
The listings I'm getting on Facebook and wherever else are listing places like the health center.
There's a lot of
so
there's also some flyers, Steve, that we update every day in the morning The borough president has been very helpful with that. Also, like spreading the word about where those sites are. It's a PDF that it's an image that you can share with people. There's multiple ways to check. I think one of the easiest ones is to go to our website to go all the locations in the zip code.
But you know what? We need to know that website. I'm a senior. I'm chair of the aging committee. I don't know how to do all these things myself. So, I need to get the information.
Yeah.
But I'd also like to get the information that you're going to be sending out to the senior centers. I'm the chair of the aging committee. Most of those senior center directors come to our meeting.
Okay. I think also at the end here, I can share my screen again with my phone number. It's my cell phone and my email, if it's easier. Okay. If not, I'm going to send Steve the notes from everything that we discussed today.
Okay.
All right. Very good. Thank you. Shoot. Is that Gabriella again? Gabriella?
Thank you very much. Very kind of you. This question is for Columbia Presbyterian.
Second,
thank you.
No, we're not up to him yet. In a moment.
Okay. And in that case, for Fernando, for the mobile testing vans, we can email you to request one for an area.
Yes, if you for a community, if you have like a community organization that you work, or a church, or any organization that we can partner you with, yes, and you can also request masks, hand sanitizers,
perfect,
shields, and all of that.
Fantastic. December 25th, MedRite Dykeman between Vermilion and I think it was Post had a line 2 blocks long early in the morning. All age ranges trying to get the rapid testing. It was ridiculous. For several days before and several days after, people want the test. The schools are handing it out to kids who were exposed, but there are tons of people who want the testing and either have to make an appointment and can't, or wait online for hours on end in the rain, snow, cold, just to get the testing because they want it and they need it. The MTA has sites downtown Brooklyn, Queens. Can we possibly ask the MTA if they can create a testing site here at 207th Street or Dykeman? But in the meantime, I love your mobile van. And that's all I'm going to say. And if I can get Columbia Presbyterian, because I have a personal question for testing for my family, that would be lovely. Thank you. Sorry.
All right.
I just wanted to add, I believe there's an additional resource for seniors over the age of 65 where they can request an in-home test, like to have someone come to their home to provide a test for them. So it's not the at-home kits, but it's actually an in-home test. So I will also email you, I believe it's run by H&H, so I can also send you that information as well.
But the seniors, I assume, have to be homebound, no?
I don't think so. I think you're 65 and older or immunocompromised to be able to be eligible. I don't think you need to be necessarily homebound.
Oh.
Mando, I mean, correct if I'm wrong. I don't mean to be speaking for H&H, but I just wanted to throw that resource out because I do know that was specifically for seniors.
Yeah, no, that's a good reminder. Also, if they need boosters, they can also request to have a team to go to their home. Yeah, no, good reminder. I was thinking more of like when we have like a good number that people that are not homebound or that they go into like a church or something, we can go there and do with a testing unit. But that's a good reminder of people who may not be able or are feeling sick or something like, or have any mobility challenges.
All right, Natalie Espino again from the Borough President's Office.
Yes, Fernando, thank you for the presentation. First of all, doing things on paper rather than requiring an email address or a smartphone is huge. Friend of the board, Coach Dave Crenshaw, spent a great deal of time creating email addresses for people so it's just so they could go get tested and vaccinated and all of that. So that's thank you. I do, Pauline, yes, they do have home testing. I will say that during the worst of it, right around the holiday weeks, you could call the number, be on hold for 45 minutes, after which you were told, we're not going to get to you, call back some other time. So getting home testing for my family was an absolute martyrdom. So just letting you know that things are getting, the demand is really high, and that's not an easy service to get. So that needs some work. And I would just say to Jay's question about fully vaccinated, while the definition of fully vaccinated for the health guidelines are one thing, a lot of venues and businesses are requiring their own definition of fully vaccinated, so that it could very well be that to go see a show at the Met, you are going to need to show proof of a booster or be no later than 2 weeks late for getting your booster. So this is how specific some of the requirements are getting. I'm putting on my arts policy hat right now because the arts and entertainment was hit so hard and had to shut down so many things right before the holidays. This is what it's looking like there now. So with your rock and roll lifestyle, Jay, and others who enjoy the arts and are hoping to participate, always find out first what that venue, that museum, that space requires.
Fernando, could we go back to the statement that Jay made that that the PCR test can result in false positive? I thought that was an issue with the rapid test. I thought the PCR tests were considered to be more reliable.
I don't have a medical background. I don't feel qualified to give like a precise answer on that. It's something that we can reach out to the Department of Health or to a professional specialist on our end, and then give you a more firm answer.
All right, very good.
I'm happy to look into that as well.
Okay. Thank you, Pauline. OC, we're up to you.
Yeah, mine is really quick. You may cover that, and I was like kind of off. Is the testing facility outside your facility on what is it, Nagel and Dykeman, coming back?
Oh, that was outside the Dykeman Family Health Center, which is part of Health and Hospitals.
Okay, is it coming back?
That's a good question.
So I'm asking, is it coming back?
Right now, we don't have a plan to return, let's say tomorrow, this week. I can bring to the team, the same way we did with High Bridge last month. I can bring to the team your request from the community board, and then circle back with you when I have an answer.
Okay.
Right.
Can we request that, Steve? We need this facility back. It was wonderful.
Absolutely, I agree. And I thought I read that there was something there that maybe it was only there for a few days. But Natalie, what do you know about this?
Yeah, there was one of the temporary sites last week. One of the vans was there at actually, I think it was across the street at the park, at the entrance to the park, because it was called Highbridge Park, Dykeman End, right? So it was right around there. But yeah, the Clínica de las Américas would be a great place to bring back the testing.
Please.
Very good. Yes, let's push for that. Fernando, tell people we want it. Sally, Sally, we're up to you.
Yeah, I just had a quick question in terms of picking up masks and sanitizer for distribution. How quickly could that be done? Because I know, for example, this weekend, we're going to have Mulch Fest in Woodhill Park. And so that would be a great location to distribute masks and sanitizer. And I just wonder if a one-day turnaround is too much to ask.
Yeah, the turnaround is usually 2 days. If there's a specific event that you think would be crucial to have, I can try to do something tomorrow. Do you have any idea of like how many people we're talking about?
You know, hundreds will come because it's right across from the farmer's market also. So it goes from 10 to 2 on the Isham Street and Seaman Avenue from 10 to 2 on Saturday and Sunday.
Yeah. If you can give me,
I'll give you a call in the morning.
You can give me a call in the morning. Tomorrow we're going to be doing another program that is going to start in schools, but I can check with you early in the morning.
Okay. And then my other question is, I don't know if it's for you or if it's for Pauline. We're seeing a lot of incidental occasions of COVID where, for example, NYU Langone, 65% of patients admitted with COVID were incidentally found to have the virus, and their hospitalizations were not primarily because of COVID. And I think at New York Presbyterian, half of the COVID admissions were incidental. So I'm wondering how that information is getting into the statistics.
I don't have that information specifically, but I have, if you think it'd be helpful, I have a graph. I don't know if Pauline has that info. If not, I have another image that can kind of give you a sense on how we're, at least on the outreach team, how we're seeing that.
Okay, that would be helpful.
Wait, so Sally, can you just clarify quickly? Are you asking whether or not we're taking into consideration the incidental COVID admissions as COVID admissions?
So when a patient goes into the hospital, they're going into the hospital for a different condition, and they're found to have COVID, and I'm wondering how that information gets to you.
Okay, yeah, I can reach out to our data team just to see how that data is collected and whether or not that's included into like the overall hospitalization data, if it's secondary as opposed to it being the primary cause of hospitalization.
Great, thank you.
So what I heard, by the way, is not just that people are being admitted, that COVID is an incidental issue for them, but that they're getting COVID while in the hospital itself. So I don't know, that would be a corollary maybe to what Sally is asking. And I was actually, that's a question I was going to ask of Julio, if there's any, if the hospital has any record of that kind of incidents of people ending up with COVID, even though that's not the original reason they came into the hospital. Okay, let's move along. Is everyone done? Jay, is that an old hand? All right, Jay is still on 125th Street. Okay, so let's move.
It's an old hand.
What is that?
It's an old hand.
I know, you're a very old hand. Okay, so let's move on to Ross Fromer, the Vice President for Government and Community Affairs for the Columbia University Irving Medical Center. Thank you, Ross, for sticking it out with us.
My pleasure, Steve, and thank you for asking us to come by tonight. I'll also add my words of sympathy towards Betty. She was obviously a great colleague and friend of mine, during my time at Columbia. Just to go over the numbers, and I just want to stress again, these are numbers for the university. These are not numbers for the hospital. So these are the Columbia University numbers. The week which started December 27th, so I guess a week ago, our positivity rate was 12.65. This may seem, it is lower than the city-wide average, but I will tell you, we're being hit as well. 6 weeks ago, our positivity rate was somewhere around 0.5%. So we've increased, somewhere around 20-fold, 25-fold, 25-fold over 6 weeks. In response, a number of things, although the undergrads haven't started the semester yet, all classes have gone virtual until at least the middle of January. We'll see what happens when we reach that date. Likewise, all in-person meetings, gatherings are on hold for now, both on campus and off. That's indoor, indoor gatherings. I will say this, that I just checked, our vaccination compliance rate is now at 100% for students and staff. Just by definition, I think that roughly means that about 99.5% of our students and staff have been vaccinated. About 5.5% have received some sort of exemption. We have also instituted a booster mandate for students and staff that will become effective January 31st. So all students and staff have until just the end of January to get boosted. I will add, for anybody who's interested, we've heard a lot of great information from the Department of Health and others. For other community groups, for this board, for other groups who are interested in learning more about what's going on, our faculty are always available to attend virtually meetings, presentations, public information sessions. So if you would like one of our experts to attend something like this, just please let me know. We will certainly try to get someone for you. That's sort of all I have on COVID. On other news, we do have some big news. We announced that our new dean, our new executive vice president and dean, will be starting March 1st. As you may recall, Lee Goldman stepped down about a year and a half ago. And Neil Rustige has been the interim dean. Starting March 1st, Katrina Armstrong will become the executive vice president and dean at Columbia University Irving Medical Center. Dr. Armstrong is an internist, is currently now the chair of medicine at Mass General Hospital in Boston. And obviously she will become the first woman dean of Columbia's medical school. The toy drive, we gave out over 200 toys to community groups in the neighborhood. You know, I don't know how this compares this to 2000. I can tell you it's significantly less than we've done pre-pandemic because we don't just not having the social events on campus, which was our, you know, sort of primary collection point, but we did do what we can to collect toys for the kids in the neighborhood. And then finally, Medical Center Neighborhood Fund, sometime, hopefully in the next couple of days, we'll open up the application process for grants for the 2023 grant cycle. And you'll be seeing that. They'll be posted on our website. And I encourage all groups to apply. Obviously concerned about a number of issues this year, food insecurity, education, but again, all community groups are encouraged to apply for the neighborhood fund. So with that, happy to take any questions.
All right, well, now it's well, before we get to Gabriella, Sally Fisher.
Yeah, I just had a question, and this is probably something you can answer in a future meeting, but I know at one point you had reported on how many medical school graduates had chosen psychiatry as their specialty, and I wonder if in a future meeting you could provide that, some updated information.
Sure, what I can easily provide to you is what residents, what internship or residency they have matched with.
Right.
We match every March. Yeah, and I could easily get the 2021 numbers for you. I don't have them at hand, and make that available at the next meeting.
Great, thank you.
One more time, though, Sally. What you're asking for the
match on residencies? So you know, I know one year I just remember there was a high rate of matching on psychiatry, and given that that's one of our biggest needs in this area, I'm just curious if we're seeing that again.
All right, very good. All right, okay, Gabrielle, it's your turn again.
Hi there. Thanks for your time, and thank you. Actually, piggybacking on Sally's question, Allen Pavilion, do they still have the psych center for teens?
I'm going to refer that to Julio because that's a hospital issue. So I don't mean to be evasive, but I am going to defer that because that's really a New York Presbyterian question.
I also have another New York. I'm sorry, Julio. Sorry.
Okay. No. Well. You have to now wait till Julio speaks. So do you have a question? That was the question that you had?
I have two.
Another one. Okay, go ahead.
Sorry. So for New York Presbyterian, I have a family member that goes to the Audubon Clinic. Great clinic, great doctor.
Gabriella, hold it.
Right. Yeah.
We're not up to New York Presbyterian. So hold the question. I'll get to you again in another few minutes. Anyone else with a question for Ross Fromer? Okay, Ross, you're acquitted. Whatever, I don't know. You're certainly not guilty. Okay, so thank you very much, and hopefully we'll get a chance to meet the new dean either virtually or in person at some point. Certainly would be great once she's on board to at least maybe have her pop in at a general board meeting and just introduce herself. And we would. And what was the name of the hospital where she's the chief of medicine?
Mass General. And I will tell you, Steve, I've already had that discussions with some of the transition folks and make sure that it gets on our calendar. I can't promise you an exact date, but I've made the pitch already to have her come to a board meeting.
Okay, very good. Of course, you'd be on top of that. Okay, very good. So we're now on to New York Presbyterian Hospital. Julio Batista, the Government and Community Affairs Liaison. Mr. Batista, are you still with us?
Thank you, Mr. Simon.
All right.
First of all, so thank you, and happy New Year to you, the members, and of course, to participants. I ditto, Betty. She was will be sorely missed, and she does. We do miss her already. Just report a little bit. Like everyone else, we have seen a significant increase in our COVID positive in recent weeks. All of our patients upon admission are tested. So anybody that comes to the hospital is tested, especially through the ED, is tested for COVID. And as of yesterday, we had 1,176 positive patients in the system, compared to 810 in 2021. A little bit less than a third of those patients are uptown campus, so we have about 350 patients that are at the Columbia site. However, Sally had mentioned, we have half of the patients are admitted for COVID. The other half is admitted with COVID, meaning that the likelihood is that half of these patients would have come to the hospital nonetheless because they have other health conditions, either to give birth or other health events. Who happened to have tested positive when they came into the hospital. So, Sally is right. There is this 50-50, count. Around 10% of these patients, COVID patients, are in the ICU. But to put this in perspective, last year there was 20% of people who were admitted were in the ICU, which shows that the disease, the Omicron is milder than we have seen in the past. So that's a good thing. In terms of, one of the things that I guess has captured everyone's attention is the staffing. And unlike other hospitals and other industries throughout the New York and of course the nation, staffing continues to be a challenge for all of us. However, the hospital has been managing to still provide full services. We are working to hire additional staff. We of course have the benefit of being a very large healthcare system, which enables us to really balance staff from, as we need it. I would also like to just say, encourage everyone, that to help, they can get those individuals who have, friends or neighbors who are not vaccinated to get vaccinated, and those who have been vaccinated to, of course, get the booster shot, which is important. We continue to have our resources at NIMIC with the hotline. We encourage people to still call the hotline if they want to schedule an appointment. Again, I know I've repeated this number, but let me repeat it again. It is 646-838-0319. People can call there and get scheduled to get the booster. So we also heard about the need to have some testing sites. I'm happy to say that ambulatory care will be stationing. We'll be stationing a van working with both El Nido and our 21 Audubon Clinic, and we'll be offering PCR tests from Tuesday through Saturday. This is a mobile van from 7 a.m. to 9 p.m. Again, that would be Tuesday through Saturday. Also, I heard that as Fernando from Test and Trace mentioned, there is a lot of hesitancy still out there with vaccine, and or want to get information on the booster shot. We have conducted hundreds of presentations, our clinicians in various languages. And again, that as a resource, we are available. It doesn't matter how large, how small the group. Our clinicians are available to provide some of these presentations to our community members, whenever they need. As a result of the increase last year, as you know, whether we had the first surge, the hospital did have to amend our visitation policy. We are again doing that, unfortunately, because of the increase. So our visitation hours for adult patients have changed to 3 p.m. to 7 p.m. So it's a smaller window, which is reduced from 12 p.m. to 8 p.m., which was 8 hours. Only one visitor is permitted per patient during this visitation period. We encourage and ask that whoever comes to visit, if that individual could be the same person each day as opposed to having someone rotate, it would be very helpful. We are, there are certain exceptions, of course, for pediatrics and obstetric patients. But again, they have to be vaccinated. Whoever's coming into the hospital has to be vaccinated, have proof of that before they're allowed to be able to gain access. We also have seen an increase on the pediatric size. I don't have the number. Again, these are been very mild cases, I'm happy to say, as has been the case with the adults. Just want to cover a couple other things that non-COVID related is that our nursing team has completed their annual code drive. Was very successful again. Provided a few thousand codes to local community members through a number of organizations, including the Washington Heights Corner Project, which was one of our big recipients. And we gave to both the Washington Heights and to their Harlem office some coats. Also, pleased to report that we're pleased to bring a little bit of joy during this holiday season by sponsoring the Duarte Triangle Park Christmas tree in partnership with Cloth, the 33rd Precinct, Coach Dave and the Uptown Dreamers, and the Washington Heights Gardening Crew, Instituto Duartiano, and the Juan Pablo Duarte Foundation. So we had an event there, was very nice, uplifted the spirits of some of the residents in that area. And we hope that this will become hopefully a tradition as we go forward. So that's really what my report today, Steve.
All right, well, that's a pretty good report. Let me just clarify a couple of things because I couldn't take it all down.
Sure.
What you say? What is the current percentage of patients in the ICU?
It's compared to last year, which was 20. This time is 10%.
And last year it was 20.
20%, yeah.
And,
people who, yeah.
And when you say there are 350 patients at the Columbia site, does that include the Allen?
Yes, correct. Yeah, that would include what we call the Columbia campus, which is anything in Washington Heights.
Okay, and Inwood.
Correct.
So that would also include the Children's Hospital or not?
Yeah, we'll include everything. Yeah.
When you talk about, I think you said that staffing continues to be a challenge and you're hiring more people. Are you hiring more nurses?
That includes nurses, although that happens to be a bigger challenge, but it's staff are all across the board, and that includes nurses. Yeah.
And there's a type of nurse apparently called a traveler or traveling nurse that from like outside the city or come to, they travel around to different locations or?
Yeah,
Are those the type of nurses that are being hired, or are we looking to hire permanent year-round nurses?
I would, let me find out exactly, but I know that, on a regular basis, we do hire permanent nurses. It is something that we do, year round. We, had seen an increase in hiring of traveling nurses during the initial wave. I'm not sure if that's the case right now, but I would confirm that and get back to you.
Apparently, the traveling nurses are making a hell of a lot more money, and they're getting all sorts of inducements to try to come to different hospitals. Certainly.
Can I just chime in on one thing quickly here?
Yeah.
Yesterday, in her State of the State address, Governor Hochul unveiled a proposal that New York would join both the Interstate Medical Licensing Compact and the Interstate Nursing Compact. It's actually comparatively difficult for out-of-state healthcare professionals to get licensed in New York. It's one of the barriers to bringing in healthcare professionals to New York under normal times. There's been some relaxation in the pandemic, but Governor Hochul is trying to address this by making it easier for doctors and nurses to practice across state lines in New York as a way to sort of bolster staffing going forward. So just something to keep an eye on as the session proceeds.
I probably didn't state it correctly. What I heard the problem is that we are losing nurses because they can make more money.
There's several issues, and I apologize for starting a policy discussion. I just want to point out that one of the challenges we find both to recruitment and bringing in folks, and frankly, to doing telehealth, is this issue of interstate licensing.
Yeah,
and anything that the state does to make it easier for other doctors and other nurses to come practice in New York can be helpful, and frankly, for our folks to see patients in other states as well.
Yeah, but what I heard from the Nurses Association is that the problem we're facing is on the other side of the coin, that we're losing people from the hospital. We're losing nurses because they can make more money by traveling around to other locations.
So Steve, and one of the things that was reported was that in addition to them, the nurses making perhaps more money being traveling nurses, is that we also, did get, from news reports that I also saw, was that because of the vaccine mandates, some of these nurses decided to say, I'm not going to get vaccinated. I'm just going to go and become a traveling nurse and not have to abide by those rules as well. So we've seen some of those that happen as well, according to news reports.
You've seen that at Presbyterian?
Not at Presbyterian. I mentioned in news reports.
Oh, okay. Well, I haven't heard that, but I mean, I'm sure there is some segment of every profession where we're finding this vaccine hesitancy or this incredible resistance to doing what's beneficial for everybody. One more question for you: the PCR testing, the van that's to be stationed outside 21 Audubon, is that now on a is that just for a 1 week term, or is that going to be for an extended period?
So right now we have it for a week, but it will be for longer than that, as long as it's needed. And so if we may, we will have it at 21 Audubon, and I'll let you know when the day comes when it will be at El Nido, which is on Broadway and 173rd Street, 174th, at the United Methodist Church.
Oh, but so that'll be sometime after next week.
Correct.
Next week, Tuesday to Saturday, 7 a.m. to 9 p.m. at 21 Audubon.
Yes, correct. Mm-hmm.
And it's just walk-ins.
Yeah.
Okay, very good. If there's a flyer that we can circulate through the community board email system, to our email list, we'd appreciate that. Okay.
So I'll ask them to produce something and send it to the board.
Very good. Thank you. To Tanya.
Yes, Julio, hi. Happy New Year. First of all, I want to say in terms of, thank you for talking about, education, because I had a conversation with someone just a couple of days ago who swore that the COVID virus was being deliberately transmitted radioactively through our cell phones. So just saying, and that's not the only person I've heard that from. So we have our work cut out for us.
Yeah, 5G.
Right, exactly. 5G. Yes, 5G. Yes. My other question, did you talk about EMTs? I apologize if you have, because I know I've read about the shortage of EMTs. Have you spoken about that? Did you speak about that? But I just wanted to know a little bit more about where that stands and what potential impacts that could have, or are we okay? Just wanted to get a little bit more information.
Yeah, so I have not heard anything from, the New York Presbyterian ambulances are part of the 911 system. I've not heard any, any issues with our participation in terms of staffing with the ENT, although, the ENT, based on some news reports, which is part of the fire department, they, as the MTA and all the other city agencies, are facing also some challenges. But I'm not sure overall. I could certainly find out from, our staff what they know in terms of overall the ENT and if there's any issues there.
I'd say I would also like to invite them possibly to next month's meeting. When we get to the end of the agenda, I want to discuss what we should have on the agenda for next month. But we're overdue for a report from EMS. Sally Fisher.
Yeah, two things. One is in terms of capacity. Now you're seeing an increase in COVID. You're also seeing an increase in other conditions because people aren't scared to come to the hospital. And I think that's affecting inpatient as well as emergency room. According to an article, I think Dr. Sharma was quoted yesterday saying volumes are back up. So capacity becomes a challenge. And I want to focus specifically on the emergency room, what's going on there. And I think last meeting, we had asked, and you had said you could bring us some information on what's going on with psych patients that presented the emergency room, where they're being discharged to. And I wonder if you have that information.
Something, Sally, my apologies, I do not have that. So, I don't have the figure, but again, in terms of our capacity, in terms of patients that are coming in, we're still good. We're not reducing any of our services. Elective services still continue. So we do have capacity and continue to have capacity as we speak. The issue just really, becomes a challenge is really staffing. But again, that is being managed. In terms of psych patients, I know that folks have a lot of concerns about what's happening with psych patients. But like any other patient, the hospital is not going to put someone on the street because they feel that they don't want them in the hospital, or they, for some reason, feel they want to treat them. Whoever is discharged has been seen, is deemed medically, able to be discharged. So, if a patient needs to be admitted, again, we do have, in terms of the psych patients, we have the Milstein, we have the beds there. We have Westchester, and we have also Gracie Square. So, that's all I could say for that. If we want to have a more in-depth discussions about that, I'll be happy to perhaps speak to Dr. Warren Ng, who does our psychiatry, and re-invite him back to the board and have a further discussion on that.
That would be really helpful. I think people just want to know what's going on with psych, particularly because the psych patients are a lot sicker than they were in the past. And I think Gabriella actually had some specific questions about the Allen Pavilion. And I wonder if you could just give us an overall update on where that stands in terms of bringing that unit back.
Well, there's no discussions at this point about restoring that unit back to the psych unit while we're still dealing with this major surge, and hopefully, this will be something that within the next few weeks we may hopefully start seeing it the numbers decline. But at this point, we're not in thoughts or in discussions about restoring that psych unit back at the moment.
All right. Okay, let's move. The last question, I believe, will be from Gabriella. Okay, now it's your turn to ask that question you had for the hospital.
Yeah, so sorry. Thank you, Sally. Looking forward to the update for the psych unit at the Allen Pavilion. 2 questions regarding COVID-19 shots for children. Have a relative going to the 21 Audubon clinic, mostly serves black and brown children, Latinx community. Asked about the COVID-19 vaccine for someone who was between the ages of 5 and 12, was told to call 311. You have a COVID-19 hotline. New York Presbyterian does. And you were also giving vaccines at Morgan Stanley Children's Hospital until the last week of last year, inside the building, giving shots to children. And it was fantastic. Don't know why we now have a van. Would be great to still have it in the building. And we're now a tier 1, as I understand it, community, as in priority community. And we can call the COVID-19 vaccine hotline and someone can schedule a vaccine, any age group, if you're eligible to get the vaccine, will get an appointment done anywhere in Manhattan or in the city. They will help you arrange that. So it hasn't been even, it was wild to me that the staff were unaware that you could go across the street, essentially, let's say 2 blocks, to get a shot for your child, not have to deal with 311 to try and figure out where you can get a vaccine for your kid. I was stunned. And I found out about the COVID-19 vaccine hotline through a friend who was actually part of a program at New York Presbyterian. I shouldn't have to find out from a friend of a friend of a friend through the gossip, through the grapevine, that this hotline is available and that folks who don't have Wi-Fi access or computer access or email addresses can actually call a phone number and get a life-saving vaccine. I've had loved ones die. I'm sorry if I'm being a bit of a drama queen, but this is so important that we get this information out. Please advise your staff. COVID-19 hotline, it is New York Presbyterian's COVID-19 hotline. I shouldn't get a flippant call 311. I was about to explode. So please get the word out. And please get the word out to the community about this service that's being applied to our community, because we're having such a high rate of disease of COVID-19 infection.
Okay, Gabriella.
Thank you for sharing that, Gabriella, with me. I apologize for that. I don't know, who was the staffer and why that would happen, but we do have, to ensure that our community, specifically our community, is aware that where they can go and get information and schedule an appointment to get the vaccine. We purposely worked with a community-based organization, the Northern Manhattan Improvement Corporation, to set up a bilingual hotline for that. And the Children's Hospital continues to be operational for the vaccine. It was not just beginning of the year. We continue to do that at that location. All our staff should know, and we'll make sure that especially at 21 Audubon is the case. We're not, the van that I just mentioned is for testing, for the PCR testing, not for the vaccine. We continue to administer the vaccine, and we'll continue to do that as long as is necessary. So, thank you for sharing that. And the argument could be, we're a large organization, but that is not an excuse. I'm glad that you have another friend that works with the hospital who had that information, but I see that there is a need to educate the rest of our staff in terms of, giving them proper information. They do not need to call 311. They could call directly the hospital or one of our partners and get scheduled.
All right, well, why don't we put these flyers up all around the hospital so that everybody can see and know that the hotline exists? I think we need to do more advertising and within and outside of the hospital. So that would be my suggestion.
Sure, thank you, Steve. And I, one of the things we did was we printed thousands of postcards of both English and Spanish. We had Coach Dave and his team and FYI and a couple of the groups, distribute those throughout the neighborhood through bodegas and
Can you mail them?
supermarkets.
Sorry about that. Can you mail it? Can it be mailed?
We can certainly email it.
All right, well, let's do another round of email blasts because we need to we need to continue to reiterate and the message and make sure it gets out there. I would like to have the community board send it out at least once a week to remind people that they should get vaccinated and that they can do so right in the community.
Okay, so what I'll do, Steve, I'll send that along with information about the PCR testing as well.
Very good. Yeah, please. Very good. Natalie Espino, back for her third time.
As many times as you like, let me, Steve. Julio, felicidades. The same thing of educating staff, add to your list the Broadway practice on Broadway and Academy. My mother has been a patient there for decades, called recently when she was exposed. She had an exposure and said, how do I get tested? And they simply said, oh, we don't do that here. Did not give her a hotline, did not tell her anything that as an elderly person, she was eligible for home testing. So we need to do better with this.
Yeah. No, thank you for that. I'll make sure that not only the 21 Audubon and the Broadway practice, but all our ACNs
very good.
Are fully educated on this. This is really disturbing. Thank you.
All right, Gabrielle, I'm glad you brought this point up. Very good. Okay, any other questions from Julio? I don't see any. So thank you, Julio. Let's move on to I hope she's still with us. Presentation on Isabella Geriatric Center. Diane Ashley from the Chief Marketing and Communications Officer for the MJHS Health System. Diane, are you with us? Okay, she may have dropped off. It is getting on pretty late.
No, Steve, she's stuck in attendees. She needs to be moved over. Her name is in the attendees.
Oh, thank you. Hold on.
I'm going to wish everybody a good evening.
All right, thank you, Ross.
Bye-bye.
Thanks, Ross.
Don't forget to talk to Kelly Bryant.
I will.
Do we even have Nick Artur here?
Hi, this is Diane. Can you hear me?
Oh, yes, Diane. Very good. Thank you for staying with us.
My pleasure. Thank you for having me. I just want to start, as I did at the Aging Committee meeting this morning, by thanking the community and the community board for the outpouring of love and affection for Betty. Obviously, it was a huge shock and a tremendous loss for the Isabella and MJHS family, as it was for the community as well. And we're moved by the outpouring of support and celebration of her extraordinary life. So thank you. I guess I'll jump right in with vaccination. Isabella's invested pretty heavily in communication and education to our families about the importance of vaccination. As a result, our numbers are pretty strong. First, 100% of our employees have received, are fully vaccinated. That's higher than the state and national average. Approximately 90% of our residents are now fully vaccinated. Again, that's at state levels, I believe, and a little higher than the national average. This process is ongoing for us. We continue to go back and revisit discussion with families who might have declined earlier to see if we can inspire them to vaccinate their loved one. We continue to roll out administration of booster shots. Nearly 75% of our residents have already received their booster. Again, that is also an ongoing process for us. Because of the, this is always important to us, but obviously even more complex and dangerous amidst COVID. In terms of flu shots, 85% of our residents have already received the flu vaccine, and that is also an ongoing effort for us. In terms of the impact of Omicron on Isabella, obviously it's affecting us as it is the community. We are testing staff and residents. Routine testing has identified a number of asymptomatic residents that has allowed for early isolation and infection control management. Impact, however, has been greatest on our staff, given that they're living out in the community. And obviously there's greater exposure there. We've put extensive efforts and plans have been already been made and are constantly updated to help mitigate staffing shortages as a result of those temporary staff outages as a result of Omicron. In terms of visitation, we're continuing to follow DOH guidelines, which allows visitation with strict infection control protocols. So that is ongoing. We are obviously adhering to and enforcing the core principles of COVID infection control as defined by CMS and DOH, and are strongly encouraging the families, importantly, to help in that regard and to ensure the safety of our residents. We are offering on-site rapid testing to family members and loved ones who come to visit, and we are strongly encouraging that people stop and get rapid testing before they go upstairs to visit. And both our Isabella and our families are grateful that this tool is helping to avoid exposures before they happen. Not on the COVID front, but just on the overarching Isabella front and MJHS. Effective January 1, we have a new CEO, David Wagner. He's been with the organization since 1999. He mailed out letters to the family members at Isabella and the residents on Monday, his first day in, reaffirming his commitment to Isabella and MJHS's commitment to Isabella and to the patients and residents that we have the privilege of caring for. So guess that concludes my part of the update.
Thank you, Diane. So Diane, he's the new CEO of Isabella.
MJHS Health System. Loyola Principal Barnett remains Chief Operating Officer of our Centers for Rehabilitation and Nursing Care and Administrator of Record at Isabella.
All right, so he's new CEO of all of MJHS.
Yes.
All right, very good. All right, well, thank you. And so what? And when you identify the asymptomatic residents, are they being put into isolation?
Yes, we are isolating.
Them for 5 days or 10 days or?
I apologize. I can't answer that question. We're following DOH and CMS guidelines. Whatever those guidelines are, I am confident that that's what we are following. But obviously now we have testing where in the beginning we did not. So we're finding asymptomatic cases, we are isolating the resident and obviously following infection control management.
And when the family members come to visit, I assume they would have to show proof of vaccinations?
No, DOH does not allow us to require that of family members.
No.
So we require it of staff. But we are not. We don't have the purview to be able to make that requirement of family or loved ones. We do educate. We do ask people not to come if they have any symptoms. And again, we implemented the on-site rapid testing so that we could try and intercede and catch any asymptomatic positives before people go upstairs to visit their loved one to help in that regard as well.
Can you require the testing?
We can't. We're not requiring the testing. I don't think we're allowed to require the testing, but I don't know the answer.
Okay. Oh, all right. Because
we're certainly strongly encouraging it and putting it in all communication to families, etc.
There was a point last year where people could not actually come into contact with their family members. They could only see each other through windows. So at this point, they can come into contact with them?
At this point, they can definitely visit. The guidelines are such that that there is no interruption of family or friends visits. I would have to double check whether or not there was a change at that time about proximity to loved ones while they are on site.
Because I think I even remember a situation where like a grandmother, the granddaughter arranged for the wedding to take place like in the garden outside the
Yes, absolutely. We've done a wedding, and I believe we are hoping to maybe do a 100th birthday, but coming up. But we absolutely did a wedding so that the mother could be present at her daughter's wedding. That was quite beautiful. But at the moment, family members are allowed to be inside the facility to go upstairs to visit with their loved one. I do not know what the specific protocols are. I apologize for when that visit takes place. Again, we would be doing that consistent with DOH guidelines.
All right, very good. All right, are there any questions for Diane Ashley, who making her first appearance at one of our Health and Environment Committee meetings? Very good. No questions. So Diane, I guess for the time being, you're going to be a regular.
For the time being, I'm going to be a regular. Obviously, Betty's loss was a shock, and we are in the process of developing a plan for going forward. I don't know how fast that plan will be in place, so you're stuck with me for a while at least.
Well, we will welcome you with open arms at any possible opportunity. So
thank you so much.
Our next meeting, but for your calendar is February the 3rd.
Yes.
All right. So thank you very much, and we now try to get to the close of our meeting. The next topic was the discussion about the brownfield cleanup plan for 4650 Broadway. Earlier this morning, I emailed the fact sheet from the State Department of Environmental Conservation and a link to the remedial work plan to the committee members. I don't know if anybody really had a chance to review the materials, but the comment period expires on January the 29th, which is pretty close to our board meeting, although it is several days away. So what I propose, I don't know if people saw the email. What I propose is that we we at least make 5 points, which we've repeated in various situations such as this one with other brownfield cleanups in our community. Number one, that the DEC should require that professional engineers always be on site to supervise the removal process of the contaminants from the site. That number two, the dump trucks that are removing the contaminated soil should take the most direct route to leave Manhattan and not go through streets in our community to the extent that they don't have to. That number three, that additional sampling should be arranged to determine whether actions are needed off-site to address any possible soil vapor intrusion into adjacent residential buildings. Number four, that the results of the community air monitoring plan should be reported to Community Board 12, especially when the exceedances of action levels are detected and corrective actions are ordered by DEC. This is information I strongly believe should be made available to the community. And number five, that copies of the monthly reports should also be provided to Community Board 12. Has anybody had a chance to review the document and want to make any additional suggestions for comments that we should offer to state DEC? Ms. Kaminer, I see one hand up.
Yeah, well, I reviewed briefly and I wonder if can we request DEC to have monitors stationed there during the construction as well? Because my point is that, can we check that there is no leftover material that be getting emitted off site after the remediation? Can we station those, I forgot what they call them, sensors on the roof of the building right to the north of the development?
I think that's a good suggestion. Let's add that to the list. Yes.
Okay, so let me just add something so you have a little more information. I know the Cornell Cooperative Extension did air monitoring in the South Bronx a number of years ago. They checked something else. It was not related to excavation. It was more related to traffic kind of emission. So, and they did station monitoring stations on roofs, in addition to the one on the street level, because the street level obviously will have higher emission. But just to check it over time, can we ask to have that station there during the construction and maybe even keep it a little after?
I don't know why not. Why can't we ask for whatever we think is appropriate?
No, but what I'm giving you is information as to, hey, it was done elsewhere, meaning they can't come and tell us that they're not doing that.
State DEC itself has done stuff like that. State DEC has put up an air monitor at least at IS 143 on 182nd Street, I believe. They've done it themselves.
Okay, and I just don't want them to say no offhand. So I'm thinking when we are requesting that, we should remind them that they did that, so we're not asking for something unusual.
Okay. All right. Ms. Bonner.
Yeah, Steve. Sorry. Yeah, my only suggestion would be, because they put out this report in December, like before the holidays, right?
Yes.
And so my suggestion would be, perhaps they can extend the public comment deadline, maybe to give some time to maybe have some sort of overview of what the final report, just something so that people are more aware, because I'm just feeling like people might not even notice that was put out. Just a little bit concerned about that. Maybe they're, I don't know. Only you would know if they would be willing to do something like that. I mean, that's above me, but I just wanted to know if you thought that was something that would be possible.
Well, so I was thinking along the same lines, because there was an occasion where we did get them to extend the comment period. I don't know, maybe it was for a couple of weeks.
Okay.
But, in this case, I'm going to ask them whether or not it can be extended for a month.
Yes.
Because I would like to see more input provided from the people who live right in that community, and we ourselves need to do a better job of letting people know about this. But even if the comment period is not extended, one of the things I want to talk about is whether or not we should invite the engineering firm in charge of this work plan to make a presentation to us in any case. Because
yes.
OC, please calm down. We, I don't think it's precluded. We can still have a conversation with them and try to make sure that they do the right thing, and then also have an opportunity for people in the community to ask questions and get answers. But so let's consider that as well. But let's assume at the moment that we have to provide the comments by the current deadline of January 29th. Let me also say that I have not finished reading this report, this plan, which is over 100 pages. And so I may have some additional suggestions by the time I write the resolution. But for the purposes of tonight's meeting, if there are any other suggestions, please let me know, or just forward them to me afterwards. Let's say that we're extending the homework assignment, and you can read the plan in the next week or two and get back to me with any other suggestions you might have. And
Okay,
all right.
Steve, I don't think I received the long form then, because I think what I received was like 3 or 4 pages.
You received an attachment, and then within my email was a link to the remedial work plan itself.
Got it.
Okay, all right, so let's move on. Everything listed under old business, you can forget about, because I don't have any of those reports. Is there any other old business? Ms. Kaminer, I've now seen 2 different hands.
Okay.
Go ahead.
Okay, do we have a date as to when the textile recycling coming back to our farmers markets?
No, we don't. But I will attempt to get an update. I did not do that before tonight's meeting.
I just wonder, why are we last? That's what I want to ask them.
Well,
of course I can. But if other markets are getting it, and I understand not all of them, why are we always among the last ones?
Well, let me tell you, the vast majority of the markets are not getting them. Very few of them have gotten them. But
why can't we be the first one to get it back?
Well, okay. Let me find out.
Thank you.
Let me find out where we stand. Ms. Fisher, do you have old business or new business?
Old business. I just wanted to follow up on the e-waste recycling. If you had talked to Lower East Side Ecology Center, because I think that might come up at the next executive committee meeting.
Well, I have not had a subsequent conversation with them, because I don't know what I can tell them. So the 2 of us need to join forces at the next executive committee meeting and see whether or not we can free up some money so that we can arrange for this.
Okay.
All right. Any other old business? No. Okay. Any new business? No. Any announcements?
Yes, Mulch Fest is happening at Inwood Hill Park on Saturday and Sunday from 10 to 2.
And what about having a chipper there for people who want to pick up fresh mulch?
Yes, it's chipping weekend. So the chipper will be there from 10 to 2. I should have said that. It's not just a drop off.
Yeah. Okay, very good.
Steve, weren't you going to say something? You said you had an item for new business, didn't you, earlier?
Did I say that?
Yeah, I thought I heard you say you were going to tell us about something for next meeting and new business.
No.
Was it about?
No.
Okay.
We have
My bad.
We have a separate item on the agenda, and which we're going to get to in a moment.
Sorry.
Yeah.
My bad.
Tanya, you promised me you weren't going to speak out of turn.
Yeah.
Are there any announcements? No more announcements except for this Mulch Fest. Okay, now we're up to your item, Tanya. For the next meeting, I have 4 possible topics that we can have on the agenda, and we can't possibly. Hold it, Emily Marte.
Yeah, sorry. I was going to say that We Act for Environmental Justice has a membership meeting the 8th of January. Is that? Yeah, this Saturday at 10 a.m. You could go on the website, We Act for Environmental Justice, like you just Google them, and they'll have the RSVP there, and you could RSVP.
Okay, very good.
Mm-hmm.
All right. So for the next meeting, we can arrange on this brownfield cleanup plan at 4650 Broadway. I've spoken to a program director at the Natural Resources Defense Council about doing a presentation on climate and clean energy issues. She is ready to do that. We can get an annual report from EMS, and we can also request from New York Presbyterian, a further presentation on either this the issue about psychiatric patients or about the discharge policy. I don't think we can possibly fit all of that. No, we can't possibly fit all of it into one meeting. So we can do the brownfield cleanup plan and do the annual report from EMS. What do people want to do?
I want to see.
I want to do the psych stuff because I think that's really critical in our neighborhood. We don't have the psych services and we have huge demand.
All right, and also try to fit in the brownfield cleanup plan or not?
I think we should try.
Excuse me?
I think we should try to fit that in.
Okay, the psych services and the brownfield.
Brownfield, yeah, those two big issues.
Yeah, well, I think we're gonna,
Yeah.
Those are two pretty substantial issues. We can't possibly spend an hour and a half on each one of them as we did tonight on the corner project. So we're gonna have to everybody's gonna have to make the same pledge that Tanya made, and we're gonna have to try to control the discussion. Okay, very good. So we'll try to work on both of those items for the next agenda. Julio, try to get us Dr. Ng for the next meeting.
So Steve, can you possibly just shoot me an email just with the date and everything that and the report that you are looking for?
Very good. I can easily do that. Okay. All right. Very good. And is there? Can we move to adjourn?
Motion to adjourn.
Okay.
Sorry, one more thing. It's Pauline. I apologize. So in the chat under Mike's initial question about what was being discussed tonight, I put in some links that Chelsea mentioned, but I'll also email everything to Steve. And I have the questions down that everyone has asked tonight. So I will answer to you as soon as possible. Thank you and good night.
All right.
Pauline, you're great.
Okay, very good, Pauline. Now I'm glad that I praised you while the other people were present from the health department.
Hey,
Okay.
Steve, tonight is my last Health and Environment Committee meeting ever.
No, don't you dare say anything of the kind. The fact that you're not working for the borough president does not mean that we don't expect you to come to these meetings in any case.
Exactly.
Right, Natalie.
You have concerns that you want to articulate, and you still are a valued contributor to these meetings. So you are not excused from any further meetings, even though in the past you've said that the Parks Committee is your favorite committee. I'm going to let you slide on that one, but I still expect you to come to these meetings. So perish the thought that that this is your last meeting. I declare you're out of order on such a suggestion. Okay.
I still love you all.
Okay, and we love you. So this meeting is now adjourned at 9:48 p.m. And I am now free to go to dinner. Thank you all. See you soon. And don't forget, if you have any suggestions on how we should respond to the brownfield cleanup plan, let me know. But I will reach out to DEC tomorrow to try to get the extension as we discussed. Thank you all.
Thanks, Natalie. All right. Bye, everybody.
Okay.
Adios.
Okay.